Thank you very much. Carolina, shall we start?
Yes, let's start. Thank you.
Wonderful. Amazing. So thank you everyone for joining. We are really, really excited at the APA to be hosting Dr. Aakash for this in-depth workshop on Srotas. So understanding Srotas and the clinical application. We had Dr. Aakash, I think in the autumn of last year, and he did an excellent workshop on Samprapti Gatakas, the development of disease, and people were so inspired that we decided to invite him back for a 4-hour workshop. So I'm sure we'll do a little bit, more of that too. So Dr. Aakash is a much loved teacher to many of us in the UK. Many of us who studied with Mayur or Thames Valley University had Dr. Aakash as our teacher. So Dr. Aakash, is kind of one of our most knowledgeable teachers that we've had, and we're very happy to have him back. He's got a lot of teaching experience, and his background is that he has a PG in Shalya Tantra, and he is currently head teacher or principal of the Jain AGM Ayurvedic Medical College in Varur, which is Dr. Aakash is still close to Hubli, isn't it?
Yes, it is.
And then he's also running a very busy clinic with his wonderful wife, Dr. Anita, who is also an Ayurvedic doctor, and also their lovely daughter, Ayuda, is currently in her Ayurvedic studies. I can't remember which year, Dr. Aakash.
It's in a final year.
Final year of Ayurvedic studies. So, fully Ayurvedic family. So we're very lucky to have Dr. Aakash here today. So how today will work. Sorry, that's a very short introduction. And Dr. Aakash has written so many, written for journals as well. So his experience is really vast. I think maybe Carolina, if you have a moment, if you could put up all the info of Dr. Aakash in the chat box. So how today will work is we will do about an hour of theory that Dr. Aakash will present, and then we'll have a 5-minute break. And then after the first break, if you have any questions, type them into the chat box. We ask everyone to keep themselves on mute and not to interrupt the teaching, but you can chat all your questions in the chat box. And then after our first 5-minute break, which Carolina has just put up on the screen, which will be at 12:30, Dr. Aakash will then go through any questions we have. Kanchan and myself will be reading them out. And then he will cover a bit more theory and then go into the activity part where we will be working on case studies and, using some of the theory we have just learned. And then we'll have a 25-minute lunch break at 1:25 until 1:50. And then again, when we come back, Dr. Aakash will answer some questions, and then we'll complete it by 3:30. Kate is just asking if the last short break timings are correct. I think we were thinking for the final short break, it will be more or less maybe around 2:45 UK time, but it might be played by ear somewhat. So I hope that's okay. So Dr. Aakash, if you are ready, you're most welcome to start. Thank you, Kate. So the 2:45 till 3:30 is actually the last teaching bit. Thanks for spotting that. So I think the last short break will probably be about 2:40 till 2:45. And then we'll have teaching from 2:45 till 3:30. Thank you.
Okay, thank you, everyone. At the outset, I would like to thank APA, Carolina, and especially Colette for inviting me back to this workshop. And I hope to do justice to the topic that has been given to me, which is understanding Srotas and their clinical application. I hope I'm audible and my slide is visible to all of you. Yeah, okay, thank you.
Yes.
Great. So thank you, Colette, for the introduction. And just before I begin, can you just tell me, I mean, who are the participants? Everyone has a background in Ayurveda. They are students or learning, or if I can get that. Any idea who?
I think Carolina, you can help me here, but yes, many have. There's a few BAMS, and there's quite a few who did the Ayurvedic degree in London.
Okay.
I think pretty much everybody's, I think, from what I can see, practitioner. Yeah.
I think there's also, I see one or two who's done, I think a 2-year intensive with Dr. Deepika, who will also know all the theory. So,
Okay. Thank you. Thanks for that. Right. Okay, so what I'll be doing today is I'll be taking you through the theory of diagnosis. What are the basic concepts that we need to keep in mind when we approach a patient, and what are the basic considerations with regarding to srotas. And as Colette mentioned at the very beginning about the samprapti ghataka, because this is how we have been taught, and that is what we do in our clinic even after 25 years of practice, is try to understand the evolution of a disease, that is in short the samprapti, and what are the different components of samprapti, how to work out the different components, because therein lies the answer to the question as what treatment has to be selected. And if you are able to write down the samprapti components, that itself will give you the clues as to what herbs you have to select, what should be the taste of the herbs you have to select, what formulations you can select, and how to approach the disease. And also it will tell you the prognosis of a disease, because today Ayurveda is at a very interesting junction of its evolution. The entire world is looking at Ayurveda, and Ayurveda offers a very unique perspective in understanding and treatment of a disease. So when patients do come to us, they have a lot of expectations, because the world over, a lot of people have already read about what is Ayurveda. Sometimes it can be too oversimplified to the point that people think that they understand everything about their prakriti and other things. And that makes it a little more challenging for the practitioner to convince the client or the patient that it's not actually so. It involves a lot of analysis and understanding of the basic concepts. So with that background, I have tried to prepare these slides, and I have also put up a few activities so that I want you to work out based on the concepts that I'll be taking in the first 1.5 session, and then we can discuss some cases. So at the end, I have some images of the patients that I have seen in our clinic. So just by looking at the images, I want what I want you to do, the activities, try to work out what all the samprapti ghatakas can be, so that the idea should be that you need to learn how to think and analyze, rather than taking the formulations. So that is not the criteria. You should be able to decide, or at least try to analyze and get to the root of the problem. That is what the whole idea or the approach of Ayurveda should be. So having said that, let us begin the journey. And as I gave the instructions, I hope that you have some books with you, texts with you, so that whenever the references come up, and if you feel some difficulty in following them, so please open them up and mark it out. I have put down the references and also the English translation, but the English translation is not in detail. So kindly mark it up in your notes. And then when you are working towards the end of the cases, so please have your paper and pen ready, so that you're able to work out the details that I asked you to work out. So, right. So let me begin by a very interesting quotation from Astanga, the very first chapter, which is Ayushkami Adhyaya. I have given on the right slide of the side, chapter number 1, verse number 6. So this is a very, it seems a very simple quotation. He says that there are only 3 doshas, which are Vata, Pitta, and Kapha. But if you look at the commentary given by Himadri, so he says that the whole idea of mentioning this at the very beginning of the chapter is, this is the goal of every Ayurvedic practitioner. That is, the goal is Vyadhi Pratyanika, that is to alleviate the disease. So why do we need to understand the dosha? Because that is what we try to work out in every client or a patient who comes to us. We need to work out the doshas. So why do we need to work out the doshas? Why do we need to understand? So in the very first chapter, he says the whole idea is to understand that you are going to alleviate a disease. And a disease is caused by two kinds of hetu, which is a causative factor. And he says there are two kinds of hetus. One is internal and the other is external. And the internal factors which are responsible for the causation of the disease are dosha and dhatu. So our entire analysis of any client, whether he is a healthy individual or a diseased individual, is based on the fact that we try to understand which are the doshas and what are the hetus. That is, the whole concept of Ayurveda is based on three skandha Ayurveda, that is Trisutra Ayurveda, hetu, linga and aushadha. Hetu is the causative factor, linga is the symptom, and aushadha is the medicine. So these are the three pillars on which Ayurveda stands. So for every symptom that is presented, there has to be a cause. And if there is a cause, a symptom has to be produced. And if a symptom is produced, we should be able to formulate a medicine. So the medicine, that is aushadha component, has to be opposite to that of the hetu, that is causative factor. Okay, so if a particular cause is leading to dosha aggravation, so the first step in treatment according to Ayurveda is avoid the etiological factor. Now, avoid the etiological factor means what? There are so we categorize the etiological factors into three components. So any client who comes to you when you're taking history, we always teach that you need to take the history or the causative factors into three components. So what are those three components? Number one is called as ahara, which is food. Number two is vihara, which is the lifestyle. And number three is the manasika, that is the related to the mind, stress, etc. So why do we need to note down these three? Suppose you note down the ahara, that is the etiological factors related to the food. Once you know what the patient is eating or not eating, so if definitely there lies a clue in those factors. So the first step is to avoid the etiological factors. Whatever food he is eating, the person is eating, whatever activity the person is doing, and what is the mental status. So you see, this very simple line seems very simple just to read it, but if you analyze it, there is a lot of scientific reasoning behind it as to why it, in the very first chapter, he stresses on this concept. So please remember, every client who comes to you, analyze the history into three components, the symptoms into three components of ahara, vihara, and manasika. So food, lifestyle, and mental activities. Then in Charaka Samhita Vimanasthana, chapter 8, which is a very important chapter of the entire Charaka Samhita. So what he says is, what is the main objective of examination? Why do we need to examine a patient? That is what we are here to understand. Clinical understanding of the Srotas and their clinical application is, it is all dependent on the examination. Why do we need to examine a patient? So Charaka uses the word Pratipatti Jnana. What is the meaning of that? Knowledge as it is, so that we can follow the protocol of management. So we need to understand what is exactly happening in the patient at that given point of time when they have come to you, till the time that the disease has developed, what is happening to the patient, and that is called as Pratipatti Jnana, that is knowledge as it is. And why do we need that? Because once we understand that in the manifestation, we can follow the protocols of management as discussed by our acharyas or as instructed by the acharyas. Then, very same chapter, again he says, the patient is the karya desha, the seat of action. So, we are taking the symptoms in a patient. We are taking the history of a patient. So while doing so, we need to understand that the body of the patient is the area where we are going to act upon, or medicines are going to act upon. So therefore, what Charaka says, examine the bala and the pramana of the dosha properly before administering the medicines. Okay, tasya pariksha, the word used is pariksha, that is examination. So what do we have to examine? Bala and the pramana of the dosha. What is a bala? Strength of the bala. Bala means strength. Pramana, up to what measure have they been vitiated? What is the extent of their vitiation? These two have to be examined in detail before we administer the medicines. So again, it comes, what is the idea that the acharyas expect us? The acharya is expecting that we follow the principles of diagnosis correctly. We do not skip any step in the diagnosis. Okay. Next, this is another quotation which I wanted to highlight here. This is from Charaka Samhita, Sutrasthana, chapter 10, verse number 11 to 13. What is this? Again, in this chapter, he gives a lot of symptoms. But this quotation here is a lakshana of a sukha sadhya vyadhi. It is easily manageable disease. So you see, as a clinician, we encounter a lot of patients in our clinics, and some of them are easy to treat, some of them are difficult to treat, some of them are very challenging. And our acharyas themselves have said that there may be instances where the prognosis is so poor that sometimes we may have to think whether actually can I treat this disease, or is the prognosis going to be worse. So the acharyas have given us a lot of caution, and they have told us time and again that please be aware of the limitations or the promises that you can make to the patient. Because today in our clinic, patient comes with a lot of hope. They have gone to Ayurveda, they have gone to allopathy, homeopathy, and all other treatment modalities that are available. And when they do not find relief or they expect more, then they come to Ayurveda. And when they come to Ayurveda, their expectation is that we are able to help them, and to what extent can we help them. So here is a word of caution for the physician. In a state of enthusiasm, or just for the simple belief that Ayurveda can help, you should not promise something which is not doable. So our acharyas, you see, if Charaka, Sushruta and Vagbhata themselves have said that if these symptoms are present, then it becomes difficult to treat, then what about us who are just not as qualified as Charaka, Sushruta and Vagbhata? So we should know our limitations. So as a physician, every day we are challenged, and we should know our limitations as to up to what extent can we help them. So don't promise anything, over promise and under deliver. So it's always better to under promise and over deliver, right? So that is how our approach should be. So keep these things in mind. As a physician, there are many such verses throughout the Samhita where they talk of such important what you call gems of caution throughout our clinical practice. Then again, see the same thing they keep on repeating again and again in every chapter. Sutrasthana chapter 10, what he says, a wise physician always examines the disease before starting the treatment. So treatment, so what does this highlight? This highlights the fact that if we have given ample time to diagnose the disease, the treatment will automatically fall in place. We do not have to bother about it, because that is what we'll try to do in the next couple of hours. Is I will try to show you how by analyzing the disease, how by writing the Samprapti Ghataka, the components, the treatment will reveal itself. You don't have to bother much. Okay, so we just have to follow the basics. So spend more time in examining the disease and analyzing the components of that disease. Then another important what you call a guideline, he says in Charaka Samhita, Sutrasthana 11th chapter. So what he says, the disease begins minutely and then grows. It spreads its roots and then kills an individual who does not take care. So again, you see there are two things which is, so the Charaka points out to the fact that the person or the patient himself should be aware of what is happening in the body. So if they do not take care of their bodies, if they do not take care of the symptoms, then they will allow the disease to manifest and spread quickly. On the other hand, if the physician is also not very careful, then he may allow that the disease in the initial stage, if it does not tackle it, then the disease will spread. So what he says is, therefore, arrest the development of a disease in its infancy and do not allow it to grow. So why is this important for us? Because when a patient comes to us, we need to identify at what stage of development the disease is. And that is what we call a Samprapti. Samprapti, the very simple meaning of Samprapti is trying to understand at what stage the patient has come to you. Whether he is in the initial stage, whether they are in the already full-blown case, or whether they have gone into a complication phase. We need to understand that. Many times we may have heard doctors tell that if this patient could have come a bit earlier, then we could have saved his life. We could have done something better. We could have helped him. So these are, so what does this mean? This means that one, awareness on the part of the patient, awareness on the part of the physician also, that when they are taking history, if we do not understand at what stage that patient is, then I think we are missing the whole point of diagnosis. So please remember, there are many important such words of caution or guidelines which have been given. Again, Acharya Vagbhata, he says in Nidhanasthana, very first chapter, he says that vitiated doshas are the cause of all disease. Sarvesham eva roganam nidhanam kupita malaha. So kupita malaha, that is vitiated doshas, aggravated doshas are the root cause of all disease. You see, at the end of the day, no matter what patient you are seeing, no matter what the diagnosis is, in Ayurveda there are only 3 doshas, right? There are 7 dhatus and 3 malas, nothing beyond that. But these 3 doshas are so complex and so intricate that they have got multiple gunas, and it is for us to understand which guna and which dosha and how they are interacting with each other. Initially, please remember, many diseases start with a single dosha. Okay, there is only one dosha involved. As the disease spreads, as the disease grows, or as time passes, multiple doshas start getting involved, multiple gunas, properties of the dosha start getting involved, and that is when a multiplicity of symptoms also will start getting developed. So when the patient comes to you, we need to identify what dosha is there, whether it is vata, whether it is pitta. The presenting symptom can be pitta. Okay, the presenting symptom of that patient can be pitta symptom. But if you take proper history, you may find that the disease actually started with vata and then pitta has got involved. So what does it tell you? It tells you that at that moment of time when the patient has come to you, you need to tackle pitta. Symptom has to be arrested. But if you do not address the underlying vata, then your treatment is incomplete. So that is what we need to understand. We need to understand that how did the disease start? Which dosha was the first to be vitiated? Then the second, then the third. And that is how acharyas have classified diseases as easily treatable, then difficult to manage. And then they also have given a category where they say that some diseases are untreatable, or the prognosis so poor that they will develop complications and ultimately they may die. So that is based on what? That is based on the multiplicity of the doshas and the symptoms which are produced. So what we have here is Roga Pariksha and Rogi Pariksha. 2 important examinations we have to do. What is Roga Pariksha? Examination of the disease. What is Rogi Pariksha? Examination of the person who has the disease. These 2 are very important. We cannot just examine the disease and treat, because the disease may be fit for treatment, but the patient may not be fit for treatment. Okay. The patient should be fit to receive your treatment. The disease symptom can be good. It fits in all. You can tick all the check boxes. 1 symptom, 2 symptoms, 3 symptoms. Everything is fine. But the patient who is actually suffering, if you do not examine the bala, the strength of the patient, the mental status of the patient, the prakriti of the patient, then we have missed the whole point of diagnosis. And for this, we have something called as pramana. So pratyaksha pramana, anumana pramana, right? So there are different tools of examination. And then very commonly, all of you are aware of the Dashavida Pariksha, the 10-fold examination of Prakriti, etc., which are very commonly known, and we need to follow those protocols. So Charaka again in Vimanasthana 8th chapter, what he says, each disease has to be examined with relation to what you have to examine. Number 1, Hetu. So what is Hetu? Causative factor. So at the very beginning, I told you what are the 3 causative factors we have to categorize. Ahara, that is food. Vihara, that is lifestyle. And Manasika, that is related to the mind. So please categorize the etiological factors into 3 components and take history accordingly. Based on that, assess the dosha, vata, pitta, kapha. Then understand the Dushya, which are the Dhatus, Rasa, Rakta, Mamsa, etc. Then go to Prakriti. Then Desha. Desha is what? Desha is the patient's body as well as the geographical distribution, where they are situated, where they are located. That is very important. See, when I used to visit London, now treating patients in India is different. Treating patients in London is different. Okay, because the Desha is different. The Rutu is different. The Kala is different. So I have to change my prescription, my advice according to that area from where the patient is. So Kala, time factor, that is also important because Rutucharya is there. Seasonal regimen is there. So if the person is following that or not following that, now today it has become, these lines have become blurred now, right? So it's very difficult and challenging to understand all the seasonal variations. What are the seasonal foods which are available? Because today everything in the context of globalization, all foods are available across the world. So everybody is eating everything. And therefore it becomes challenging as to how each person reacts to that food or the activity. Then Bala of the patient and Bala of the disease. Both are important because our Acharyas tells, for example, if you are planning to do Panchakarma, the person should be of good Bala, strong Sattva. Mentally he should be prepared, he should be ready. If he is weak patient, then the Acharyas say, please be careful when you are doing these things. So these are the same components we'll see later on, which we call them as Samprapti Ghataka. So definition of Samprapti. Okay. So I will just quickly go back. So what it says, these are the few quotations I have mentioned, but basically Samprapti, the word Samprapti, sorry. Samprapti means proper knowledge, Samyak Prapti. Proper knowledge of the disease is called as Samprapti. Okay. Now, so what he says here is Kha Vaigunya. If you see a Sushruta Samhita in chapter 24, Sutra Sthana, he says that wherever there is Kha Vaigunya, Kha means what? Kha is a synonym of the Akasha Mahabhuta. Okay? Kha is a synonym of Akasha Mahabhuta. So what is Akasha Mahabhuta? It is space. Wherever there is a vitiation or Vaigunya, Vaigunya means what? Wherever there is a defect, wherever there is a vitiation. So what are the structures which are having space? We call them as Srotas. So whenever there is a vitiation, whenever there is a defect in the Srotas, the doshas will go and lodge there. Once the doshas will go and lodge in that particular Srotas, then the symptoms will start developing. Okay, symptoms will start. I'll just give a simple example. This is a common example that I always tell. Now in this meeting that we are having now, we are about 25-26 people. Okay, imagine all of us go out and have ice cream. Okay, let us imagine that all of us are in the same age group and we all have the same flavor ice cream and the same quantity. Okay, let us say a tub of vanilla ice cream. Now, what do you expect will happen after everyone eats the ice cream the next day? Will all of us fall ill? Will all of us develop symptoms? No, all of us will not develop symptoms, right? Now, amongst the people who develop the symptoms, will all the symptoms be the same in all those people? No, right? So what does this tell us? This tells us that even though we are of the same age group, even though the hetu, which is the etiological factor, is the same, but the presentations will be different. In some individuals, they will develop fever. Some individuals may develop running nose. Some individuals may develop upset stomach. So you see, pranavaha srotas, rasavaha srotas, annavaha srotas are getting affected. By what? By the same etiological factors. Now let us assume that on the first day, 5 people fall ill. The second day, again the remaining people, let us go out and have the same ice cream again. So I think by the end of the 1 week, all of us will fall ill. Some people will take 7 days to manifest the symptoms. So what does this tell us? This tells us that in our body, The doshas are waiting for a very opportune moment to get aggravated. In some individuals, they are so predisposed that with a minor provocation, they will manifest a disease. In some individuals, the body immunity is so strong that they will not allow the doshas to provocate, and they will wait for a continuous repetitive nidana, etiological factors. And this is what patients tell us. I have been okay all these years. My health was very good. It's only in the last couple of months that I have started feeling these symptoms. So what does this tell us? This tells us that they have been exposed to the etiological factor, but there has been a constant developing of the symptoms, but their immunity has prevented the symptom from developing. But by the time they have come to us, their immunity has weakened and the symptoms have become so strong that it has become a full-blown disease. So this is what Samprapti means. Samprapti means understanding the journey of the development of the disease. Okay, journey of development of a disease. So you need to understand when the patient has come to you as to where are the doshas now. Where are the doshas? How are they traveling? Okay. Now suppose, let us say that you have caught your train at London station and you want to get down in Birmingham, right? So your destination is Birmingham. So the doshas have started traveling from London and they are traveling to Birmingham. Now at Birmingham, somebody must be there to receive them, isn't it? If something happens on the way, on the track, anything can go wrong, right, between London and Birmingham. So the patient can be caught at any way, right? This is the simplest example I can give. The patient, say for example, diabetes. Today, diabetes the world over is very common. Okay. In Ayurveda, we tend to think that diabetes means prameha. We call it as prameha in Ayurveda. Now, what do the acharyas tell us? The acharyas tell us that when the doshas and the dhatus get afflicted and they start coming out of the basti, that is bladder, only then we have to call it as prameha. Right? This is the definition of prameha. Now, where are we catching hold of this disease now? In the present clinical context, how do we diagnose diabetes? Anybody can tell me? How do we diagnose diabetes today? Commonest method of diagnosing diabetes is?
Yeah, we take all those, blood sugar levels and all into account.
Right. So it's a blood. Where are we checking it?
Through the blood, obviously.
Blood. So Rakta Dhatu,
Yes.
right? Rakta Dhatu.
Yes, Rakta Dhatu.
So,
yes.
So we are trying to catch the disease where in the Rakta Dhatu, and we are trying to equate it with a disease which has been described that this is a disease which has to come out through the bladder. So what does this tell us? This tells us that the doshas are still traveling. They have not yet reached Birmingham. We are trying to catch it somewhere else. And what we are trying to do in Chikitsa, we are trying to apply the medicine which has been described in Prameha to a disease which we are diagnosing in Rakta, which will never work. If you open Charaka Samhita and see what formulations he has given for Prameha, those formulations are not used in the treatment of Prameha. We are using what? We are using medicines described for Rakta Dhatu. Therefore, all the medicines which are described in Kushtha, skin diseases, they are the formulation that we use today to treat management and manage diabetes. So this is the reason that we need to understand the Samprapti. Where and how the disease is progressing, how they are manifesting, where are we trying to understand what is actually happening in the patient? Are we trying to understand the journey of the dosha? Where are they lodged? Okay, they can lodge in multiple dhatus. They can lodge in multiple srotas. So we need to understand which srotas are they lodged in, and that is why this whole concept of Samprapti Ghataka is, so that you can formulate a particular protocol of management for each individual. So Vigunata, please remember, Sroto Vaigunya means there is a defect, there is a predisposition. Some people are predisposed to develop a certain diseases, and that predisposition can be inborn, can be acquired by many other factors. That is what acharyas tell us.
Can I ask a question, please? If a patient has diabetes, usually the prodromal symptoms are polydipsia and polyuria. The physician in this case would be, in the old-fashioned way, tasting the urine to see how sweet it was, or looking at the cloudiness like albuminuria to see that there are proteins in the urine. So it wouldn't necessarily be a blood test at the beginning.
Exactly. That's the whole point that I'm trying to say. In that case, we don't call it as prameha or diabetes mellitus in that sense. In Ayurveda, we have got different nomenclatures for different manifestation of the urine, which the acharyas have given name to, but we are not following those protocols. That is what I'm trying to point out is our acharyas were aware of the different dhatus which are going to come out of the urine. But today we have limited ourselves to only blood test. There are so many other modalities by which you have to understand, and that just gives us a whole new area to analyze and understand. And if you understand that, then your application of the treatment will be better. That is what acharyas say. Okay. Right. So further questions probably I can take up later. Again, same thing which has been described by acharyas. Manifestation of a disease is samprapti. So that is what I have told you here written. Vitiated doshas will travel, they will lodge and create multiple dosha imbalances. So what the basic thing that every physician is trying to do is understand this journey of the doshas. Right. Again, in the, I think in the notes that I sent, I asked you to make a list of all the ama lakshanas. Why is this important is, we will discuss this in the treatment. So again, very quickly, I will take you through ama lakshanas, because it is said that ama is the root cause of all diseases. So in Astanga Sutra Sthana, chapter 13, they list 10 symptoms of a ama. So if any of the patient that you get, or if you in your clinic, if you have these ama lakshanas, then the only treatment that you need to do is you have to remove the ama. Without removing the ama, you cannot proceed further. So it is for this simple reason, because ama causes blockages. And whenever there is a blockage in the srotas, your medicines will not reach that particular targeted srotas. So we need to understand ama, presence of ama, and what are the symptoms. So I have written down the symptoms here. We'll discuss this when we are talking about the cases, so that you understand it better. So first symptom itself says sroto avarodha, blockages in the srotas. So if the srotas are blocked, then without removing the blockages, you cannot do further treatment. So multiple srotas can be blocked or single srotas can be blocked, and ama will cause these multiple symptoms. So please take note of this. Then coming to srotas, because that is the main highlight of the discussion today. With this background, let us try to understand srotas. So what are srotas? Charaka says all entities in the human body are dependent on the srotas for growth and decay. Okay. So the human being is said to be made up of srotas, multiple srotas in the body. And what are these srotas actually? Srotas are the channel through which the dhatus undergoing transformation are carried. So whatever we eat has to be transformed into dhatus. And what is the function of the srotas? The function of the srotas is to carry those dhatus which are undergoing transformation. Right? So these are the channels of transportation of the dhatus which are not yet completely formed. So these are the pathways. These are like the waterways. These are like the irrigation channels. If you remember, Acharya's talk of three rules of dhatu nourishment. Okay, and one of those three nyayas, they are called as laws. The three laws of dhatu nourishment. One is the complete transformation. Then the theory of a hungry pigeon eating grains, and the third one is the body is compared to that of a field which is irrigated by channels. So the srotas will irrigate the body, and they will nourish the body by supplying the nutrients. And these nutrients which are being transported through these srotas will ultimately end up getting converted into respective dhatus, and that is how the body is nourished. So these srotas should always remain clear, that is free from blockages. And that is what our whole idea of today's discussion is: how to understand the srotas, how to understand the samprapti, where it is happening, and how do we understand in which srotas the blockages are there. That is what we are trying to understand. Again, Charaka says srotas get vitiated by ahara and vihara. And the dhatus get vitiated by factors which are not conducive to the respective dhatus. So each dhatu is nourished by a particular srotas, and the srotas gets affected by ahara and vihara. Again, here in vihara, physical and mental both. So in the beginning, I told you there are three components: ahara, vihara, and manasika. So I have further categorized vihara. Vihara is activity, so into physical activity and mental activity. So if you see that, there's the same thing which has been discussed by the Acharya. So what we need to do here is understand these components so that we understand what srotas, which part of the srotas is affected. So what are the diagnostic considerations? Very quickly, whatever we have discussed, I'll try to quickly recap. Assessment of prakriti, assessment of the bala of roga and rogi, patient and the disease, assessment of ama lakshana is very important, then assessment of the status of agni. So agni is the digestive fire. So if the digestive fire is weak, then ama develops. If ama develops, then the symptoms will be more pronounced and the complications will begin. So these are the diagnostic aids that we have in Ayurveda. We have the Dashaveda Pariksha, we have the Ashtasthana 8 fold of what we call the Pariksha, and it always helps, whenever I teach, I always tell all the students to make a chart of Dosha, Dhatu, Mala, Vriddhi and the Kshaya Lakshanas. Okay, the symptoms of aggravation and the Kshaya, the Vriddhi and Kshaya. So please maintain a chart. Whenever the patient starts complaining, try to locate the symptom and mark it so that it helps to you to know whether it is a Vriddhi Lakshana or whether it is a Kshaya Lakshana. Because if there is Vriddhi, your treatment protocol is different. If there is Kshaya, your treatment protocol is different. So in order to understand that, we have to always follow this simple rule of having a chart at your side. So as you keep on doing it, then you know the symptoms. It will get accustomed, you will get habituated to it. So you yourself can understand. And the next time the patient sits in front of you, you can tell them, okay, do you have this? Do you have this? Do you have this? So the patient will be amazed at, how do you know that I'm having this? Because it follows logic, right? If vata is aggravated, then we have 10, 15 symptoms. So you recount them in your head and you ask those questions, and the patient will answer yes or no to those questions. Most of the questions will be yes. So that is the way, because the body reacts in a particular way. And if we know that which dosha is aggravated, which dhatu is affected, if we ask the related questions, then it becomes easy to understand the disease which is developed. Again, Sushruta, he tells importance of proper history taking is very important. So in our consultations, we spend at least an hour with each patient. Our consultation lasts because we have to go through all the details so that we then, if not, then it leads to confusion. So it goes without saying that if you don't take proper history, if you don't analyze the details correctly, you can end up with confusion. Why do we have to do all of these things? Is the goal of Ayurveda is to attain equilibrium of the dhatu. Again, here dhatu is a word which is used for dosha as well as dhatu. That is the karya, action to be taken. As a physician, what is the action that we have to take? We have to ensure that equilibrium is established. By our treatment, no other symptom has to be produced, or symptom should not get deteriorated, or some other new disease should not be produced. That is the whole goal. Why we have to do all these things, why we have to follow all these things is simple. Dhatu Samyata. Again, Charaka, it may seem repetitive that the same thing is being told, but it helps to us to reinforce the fact that acharyas want us to think of this again and again. So what he says, the properly initiated treatment brings about arogya, that is equilibrium. So our whole idea is to establish the equilibrium. We try to understand what is the imbalance, try to set it right. Now, in the present day clinical context, as we are trying to understand many diseases that are presenting to us, for example, polycystic ovarian disease, different kinds of cancers, multiple sclerosis, so many newer and newer diseases are coming up, and so many other diseases are there which may not be explained in Ayurveda. So acharyas very clearly tell us, Vagbhata very clearly tells us, it is not possible to name every disease. There is no need to name any disease that comes to you. And they use, if you read the commentary, I have given it here, there is no need to feel embarrassed if you cannot name the disease. because acharyas themselves says that not every vitiation of dosha can be given a name with certainty. So forget about naming a disease. Don't fall in the trap of calling out a disease of particular name or a symptom by a particular name. Try to understand the dosha, dhatu, srotas, etc. And if you are able to do that, you might as well initiate the treatment. Okay, so there is no need to name every disease that is presented. It is very tricky. For example, hypertension. Till today, there is no consensus among Ayurvedic physicians as to what name has to be given to the word hypertension. Now, if we waste our time trying to find a suitable name for hypertension, we will all lose the focus as to how to treat hypertension. What is the limitations of Ayurveda in treating hypertension? So on and so forth. So let us not fall in the trap of naming every disease or trying to find every disease possible in Ayurveda, but we have enough guidelines in Ayurveda so that we are able to analyze every clinical presentation that comes to us. That is very important. Okay, so this is what Astanga there. These are the possible components of Samprapti Ghataka. Dushya, Desha, Bala, Kala, Agni, Mala, Prakriti. Again, all the Dashaveda Parikshas. I will not go through the details here. The reference is given. Right. Now we'll properly enter into Srotas, definition, formation, srotodushti, chikitsa, etc. Samprapti Ghataka analysis, and then some case discussions. So basic considerations, again, references I have given here. Charaka Vimanasthan chapter 5 and Sushruta Sharirsthan chapter 3 and 5. So these are the chapters where you will find the discussion about Srotas. What is the difference between Charaka's approach and Sushruta's approach? Charaka talks about dushti, that is imbalances or vitiation, whereas Sushruta talks of injury. Because Sushruta was a surgeon, he talks of injury to the Srotas. So the manifestation and the symptoms and the treatment may be different. So what are the definitions? We already saw it. Channels that carry dhatus that are undergoing transformation, and the body is full of srotas. Charaka says the body, even though he names that there are prana, anna, udaka, etc., but he says that there are vata carrying channels, pitta carrying srotas, kapha carrying srotas, and manas carrying srotas. Even the mind, he says, travels throughout the body. So that is very important concept which Charaka gives us. So how it is formed? Each srotas is formed. Okay, very important. Each srotas is formed by vata, pitta, and kapha. All the three doshas make up the formation of the srotas. There is the component of rakta, then a sneha portion of medas and mams. It is a maternal product. In Ayurveda, all the organs of the body are divided into whether they are derived from the father or whether they are derived from mother or other components. Charaka talks of 6 components of which every body organ is formed. So srotas are formed from the matraja bhava. What is the importance of clinical application here? Why do we need to know this? Why the understanding of the formation is important? Because whenever we are treating a particular patient or a disease, our medicine should not alter the basic formative components of the srotas. It should not destroy, it should not alter rakta, medas or mamsa, because that is where it is formed. So that is why in Ayurveda, after every treatment of a disease, rasayana chikitsa is advised. Okay, what is rasayana? If you break up the word rasayana, rasa and ayana. Ayana means srotas. Ayana is srotas. So every disease, after initially you alleviate the symptoms, we have to give the srotas strengthening, nourishing medicines. That is very important concept in Ayurveda. Now, types of srotas, according to Charaka, they are different. According to Sushruta, they are different. For the very simple fact that Sushruta was a surgeon, he has not described 1 or 2 types of srotas which Charaka has described. Now, clinically, it may not make much of a difference. I'm not going into details of which srotas Charaka has described and which srotas Sushruta has described. Please follow it up with your readings of the chapters that I have given it to you. Now, srotodushti. This is what brings us to the disease. Collect, it's almost 1 hour, 55 minutes, I think. Do you want to take a break now? Or?
Yes, Dr. Aakash, that would be great.
Okay. So 5 minutes?
Yes.
Shall we break for 5 minutes?
So it's now 12:21 according to my phone. So 12:26. And then we can do maybe a few questions.
Yeah, sure.
Amazing. Thank you, Dr. Aakash.
Thank you. ಮುಂದೆ ವರ್ಕ್ ಆಗ್ತದೆ ಆಯ್ತು ಒಂದು ಪದ ವರ್ಕ್ ಆಗ್ತದೆ ಹತ್ತಿರ ಸರಿ ಲಾಸ್ಟ್ ಇದೆ ಏನು Srotas.
Great.
Can I start?
Yeah, I think it's now 12:26, so hopefully most people are back.
Okay.
I don't know, Dr. Aakash, if you're ready to take a few questions.
There are.
If you want to finish something first.
Yeah. No, I'll just take a couple of questions if there are any.
Wonderful. So I'll start with the first one, and then Kanchan and I will alternate.
Mhm.
So we've got a few questions from Kate, and she said, don't worry about answering all of them if you don't want to. She was saying, Astanga Hridayam Nidanastana 1 verse 12, that you put on, vitiated doshas are the cause of all disease. If the same is said for ama, how do you explain the two statements both existing?
Yeah, ama is caused by the derangement of the Agni, and Agni is deranged by the doshas only. So there is Vishamagni, Tikshnagni, and Mandagni. So ultimately, you come back to the vitiated state of the doshas only, leading to ama formation. So ama formation, you can say, is the next state of the vitiated doshas, which affects the Agni, which in turn, so both together, they are not contradictory statements. Ama is caused by the vitiated doshas itself. It's like saying, there is a quotation which Shrota says, when you say that, let us, he gives the example of a patient who has come to you with a burn wound, right? And when you ask history, and if you say that, what did you get, how did you get this burn? And the answer is, I got burnt by ghee, hot ghee. Now we know by nature that ghee doesn't burn. Ghee is always soothing. So what burned in the ghee is the pitta component which was there in the ghee which burned. So it's always the dosha, inherent dosha, which can cause all the manifestation. So vitiated doshas will affect the Agni, leading to the formation of ama. This ama further travels and it makes matter more complicated. So in a way, both are complementing each other in manifestation of a disease.
Thank you, Dr. Aakash. The next one is from Kate again. So she has been asked about modern equivalents of srotas. So obviously for some of that is easy, like GI tract, respiratory, blood vessels, and lymphatic channels, but others are harder to equate. So she's just asking, do you have any thoughts on these, please?
Yeah, equating, my understanding is that it's not always possible to equate every srotas with possible modern understanding. I have always believed that, if when a patient comes to you, you try to look at it from an Ayurvedic perspective, that the patient is made up of dosha, dhatu, mala, and srotas, and then try to integrate whatever knowledge you have about the possible modern diagnostics and other treatments, and then take it up with the Ayurvedic components. So yes, it is quite challenging because we cannot find a possible name for every srotas that is. For example, Mutravaha is easy, Svedavaha is easy, Purushavaha is easy. Now, Astivavaha Shushruta doesn't talk of because Asti is present throughout the body. Majjavaha can become a bit easier because we're talking of. So most of the srotases can be easy to name, but only when the disease starts manifesting in multiple srotases and how they travel can become tricky to understand from an Ayurvedic perspective. Because looking at disease, I think the challenge is not to mix both of the sampraptis or the pathogenesis. If you try to analyze modern pathology based on Ayurveda, then it becomes a little bit challenging. At the same time, trying to analyze Ayurvedic samprapti based on modern understanding of the body, tissue, fluids, etc., that also can be a bit challenging. So it's all about how you integrate it. Like I said, like the Acharya said, it's not always necessary to find a particular name for everything which is described. So I think taking the middle route and trying to analyze, at the end of the day, if you're able to understand what is happening to the patient and if you're able to give treatment, that should be fine. You're on mute, Colette.
You're on mute, Colette.
Oh, sorry, thank you. Kate was also asking if you ever use dosha kashaya lakshana in your practice or in practice.
Dosha kshaya lakshanas, yeah. Yeah, generally, acharyas have very clearly stated that it is always the dosha vriddhi lakshanas which cause more trouble to the patient. But for example, if there is a vata vriddhi lakshanas are seen excessively, then rasa kshaya lakshanas are seen, dhatu kshaya lakshanas are seen, which means that even there is kapha kshaya lakshanas are seen. So if you try to, when you're trying to treat them, then obviously we have to keep a track of whether the kapha vruddhi is also taking place because of the treatment. Obviously, it goes without saying that if you try to treat vata vruddhi, it will automatically do kapha vruddhi also. Sorry, if there is vata vruddhi and if you are going to do vata kshaya, kapha vruddhi automatically will take place. But dosha kshaya lakshanas are not as troubling to the patient when compared to dosha vruddhi lakshanas. But yes, we do see them in our clinic. But dhatu kshaya lakshanas are more prominently seen compared to dosha kshaya lakshanas.
So this is the last question for this session, and it is from Dr. Roy Sat. How long you can continue giving medicines without a break? 3 months, 6 months, please.
Okay. Yeah, it again depends on the disease that you're treating and the status and the stage at which you're treating. Acharya Vagbata very clearly says that you should see some results within 7 days of the treatment, initiation of the treatment. If you do not see any change at all within the first 7 days of your treatment, then rethink your diagnosis or rethink your medicines. But he says that if you are able to see some changes, even if it is a 5%, 10% change, then continue with the treatment. Generally, if you're asking me with regards to how long to continue the formulations that you are giving, the general rule is if you are giving herbal medicines, of course, in UK, Europe, and America, you can't give herbal mineral preparations or rasaushadhi is what we call them as. Ideally, you should get some relief or results within the first 21 to 30 days. If not, then continue. So maximum duration that we tend to give is about 3 months, within which time we should expect the desired results, or then give a break, change the medicines, or put the patient on something else like a diet, etc. Then restart the medicines. But if you're using Gugulu preparations, any of the Gugulu preparations, give it for 21 days, give a gap of 10 days, 15 days in between, then again restart the formulation. The maximum number of days that you can use the rasaushadhi is for 48 days. Do not exceed 48-day duration of the rasaushadhis, which means that give a break and then restart. So it all depends on what medicine, what dose, which disease, and which stage you are treating. But these are the general guidelines I think will be helpful for anybody.
Thank you, Dr. Aakash. That's the questions for now.
Okay.
So you can start.
Thank you. Right. So we were discussing about the srotas. Again, srotas dushti, that is, Ayurveda acharyas talk about 4 types of vitiation or impairment that every srotas can undergo. And I have put up a table here and possible understanding how to analyze it. For example, there is a type of srotodushti called as Astanga, which means obstruction. So again, obstruction can be anatomical obstruction or physiological obstruction. The doshas can get blocked, or anatomically there is something in the srotas which is blocking the flow of the nutrients of the doshas. Ati pravritti, excessive flow. So again, this always is majority times is due to physiological impairment of the srotas. Vimarga gamana. Vimarga gamana. Gamana means gati or movement. So opposite flow or flow into other channels, which means that the dhatus or the doshas which are in a particular srotas, instead of traveling in their own channels, they will enter into other channels. Now this obviously has to be a physiological phenomenon. And the last variety is called as sira granthi, which is a swelling, which always has to be anatomical because the swelling is generally anatomical nature. So if this is the basic understanding. Now, why this is important to understand is when a patient has come to you, next we'll do that in the Samprapti Ghatak analysis. We need to understand if you are talking of, say, Annava Srotas or the GI tract. Now, if you call the entire GI tract, it contains 2 Srotas. One is Annava Srotas and then second is Purishava Srotas. So we have to be specific here. So Annava Srotas, if you're talking of Sanga, what is the symptoms? Can there be Sanga in Annava Srotas? Can there be Ati Pravritti in Annava Srotas? Can there be Vimarga Gamana in Annava Srotas or Siragra? So each Srotas you have to think which are the possible, or there is no hard and fast rule that all these have to occur in all the Srotas. Okay, that is what we have to understand, and that is what will help us to formulate the treatment. So basically, remember, there are only 4 kind of impairments that can happen in a srotas. In your patient, you have to find out what is the impairment, because the treatment is exactly the opposite of the impairment. If there is sanga, obstruction, what is the logical conclusion in treatment? Break the obstruction, release the obstruction. If there is ati pravritti, if there is excessive flow, what is the treatment? Stop the flow. If there is vimarga gamana, what is the treatment you have to do? Bring back the doshas to the normal flow. Then anatomically, obviously here, surgical options may be there, but other treatments also can be tried. So understanding the srotodushti will tell us the exact line of treatment that you have to follow, which forms a part of the samprapti ghataka. So chikitsa sutra, I'll come later, we'll discuss this later. Now, samprapti ghataka, what are the things that you need to need down? What are the components of samprapti? Samprapti ghataka means what? Components of a samprapti, evolution of a disease pattern, which in modern terms is called as pathogenesis. Why it is important? Essential to understand the factors involved in the manifestation of a disease. Helps us identify the area of focus to initiate the treatment. Helps us decide the chikitsa sutra, that is the treatment protocol that we have to adopt. It also guides us to choose the herbs and formulations. It cautions us to the prognosis of the disease and helps us to assess the outcome of our treatment, medicine plus diet and lifestyle. So this is the reason that we have to do the samprapti ghatakas. In each srotas, what srotas and other things will be there. This is what we'll discuss later. Coming up. So what are the components of samprapti ghataka? Now I would request all the participants to please write down these in your notes so that the cases that we will be I will be asking you to analyze, you have to give me the answers based on these only. So dosha, the first component of samprapti ghataka is dosha. Okay. Now dosha again here, plus I have written amshamsha kalpana of dosha. Amshamsha means a subtype of dosha. It is not sufficient to just write whether it is vata, pitta or kapha. You need to write which subtype of vata, pitta and kapha are affected. Can you work that out in the patient? That is what we have to find out. The next level of analysis should be in each type of vata, pitta, kapha, whether it is qualitative, functional or substance wise, or the quantity wise increase, quantitative, qualitative and functional increase or decrease of vata, pitta and kapha. For this, you need to know the gunas of vata, pitta and kapha. Okay, that is very important. So we need to know this. So please write down dosha, under dosha, subtype of dosha, under subtype of dosha, guna of each dosha, whether there is an increase or decrease of gunas of the doshas. That is what we have to analyze. After dosha analysis comes dhatu analysis. Which dhatu do you think is involved? Rasa, rakta, mamsa, whatever it is. Then Agni. So you know that there are 3 types of Agni described in Ayurveda. Jataragni, which is the main Agni, Dhatuvagni and Bhutagni. Now Bhutagnis are very subtle, so we will limit ourselves to understanding only Jataragni or Dhatuvagni plus Ama, if Ama is present. That's why I told you the Ama Lakshanas. If Ama Lakshanas or symptoms are present in a patient, the treatment protocol has to be to digest the Ama. Then Srotas. Which Srotas do you think is involved? Now this is related to what? Dhatu. If you write down the Dhatu, you can write down the Srotas involved, but not always necessary so. Then Srotodushti. What do you think? How many Srotodushtis are there? 4 types of Srotodushti. You should be able to write down. Now it is not mandatory that in every patient only one should be present. There can be 1, 2, 3, 4, one leading to the other, whatever it is. Then next is Udbhava Sthana. Udbhava means where the disease has originated. In which Srotas the disease started. Sanchara Sthana. In which Srotas the doshas are traveled. Vyakta Sthana, where the doshas are manifested. Adhisthana, where the doshas are finally localized. So you see what this tells us? This tells us about the entire journey of the dosha. where they started, how they moved, where they lodged, and where they manifested. And then in Ayurveda, we have something called as Roga Marga. So what is Roga Marga? Pathway of disease. In Ayurveda, there are 3 Roga Margas. Okay, peripheral, central, and middle Roga Marga. So peripheral is Rasa and Rakta Dhatu. Central is the entire GI tract. And Madhyama Roga Marga is bone and marma areas. So you need to understand where the disease is located, in which pathway. Why? Because based on this only, sadhya or asadhya can be understood, whether the disease is easy to treat or difficult to treat. Then Chikitsa Sutra. That will, I'll tell you what you have to write, how you have to understand. So the guidelines again, very quickly, I'll tell you Dosha, Dhatu, Mala, Agni, Ama, and Srotas. These are the guidelines that we are going to work on. Okay, just a quick activity. I told you Vata, subtype of Vata. Can anyone tell me the subtypes of Vata? Can you name them in order, please? Or if anybody wants, yeah, type in, you can type and collect, or somebody can check it. Yeah.
Okay, so like 5 types, no?
Yeah.
Pran, Udan, Vyan, Saman. How many I got? I got 4.
4, yeah.
Sorry, I think 1 missing. Pran, Vyan, Udan, Saman, Apan.
Apan, very good.
Yeah.
Pitta. Sorry, there is a spelling mistake here. Subtype of Pitta. Can you tell me the subtypes of Pitta? Anybody? Or Kapha, whichever you want.
Pachaka, Ranjaka, Sadaka, Alochaka, Brajaka.
Yes. Kapha. Okay, Kledaka Kapha. I will start. Kledaka.
So it's Avalambak, Kledak, Tarpak, Bodak, and Shlish.
Shleshaka. Yes. Thank you. And similarly, you have to know the what are the Vata Gunas, what are the Pitta Gunas, and what are the Kapha Gunas. Okay. So Vata has got, if you follow Astanga, there are 6 Gunas. Each of them are 6 or 7 Gunas. So that is what you have to understand. So please make a note of these things, because later on, the next few slides, you will see why this is important. So please try to recollect and try to understand these, so that you have to work this out in the patient. That is very important. Sorry, this is from an old slide. Yeah. So Samprapti Ghataka, this is what you Dosha Amshamsa consider. Dravyataha. Dravyataha refers to the entire existence of the dosha. Vata is subtle and is therefore difficult to assess, but Pitta and Kapha have more gross forms and they can therefore be assessed by this parameter. Dravya refers to quantity. So Vata is subtle. It is having no, you cannot, it is not matter. It is just space. So it's very difficult to assess that. But Pitta and Kapha, they have described. Guna is very important. So Guna refers to what? Quality. So Vata has qualities, Pitta has qualities, and Kapha has qualities. So we need to understand which quality of the dosha has caused that particular symptom. Next, whether that symptom is because of increase of that quality or decrease of that quality. I'll give a simple example to drive home this point. Imagine that there are, think of 2 patients. One is a paralysis patient and the other is a patient who is having Parkinson's. Okay, the paralysis patient and a Parkinson's patient. Now, in both of them, which is the common dosha which is affected? Can you tell me?
Vata dosha.
Vata dosha is affected, right? Now, in both of these, which in the paralysis, which guna is affected? Which quality of Vata is affected?
Ruksha.
A paralysis patient will not be able to move the hand, right?
Yeah.
Or do the activity. So which quality are we talking of?
Chala.
Chala guna.
Chalaguna.
Okay. So Chalaguna has increased or decreased?
Decreased.
Decreased,
Yes.
right? Now, what is happening in Parkinson's? It is same Vata,
It's increased.
it is increased. So, in the first patient in the paralysis, what should be your treatment? You should stimulate Vata, right?
Yes.
Because the movement is decreased, you have to stimulate Vata. So, your treatment and medicines will be different. In Parkinson's, you have to control Vata. Right? You understand what I'm trying to tell you? So if
Yes,
you
sir.
are able to understand this, then the treatment protocol will automatically manifest. So if you are able to analyze this in each patient, in each symptom that is given to you, then it becomes easy to develop your treatment protocol. It has to fall in place. It will fall in place. So please remember, try to work out, try to recollect and use these gunas and the subtypes so that it helps you to understand the symptom better. We'll see that. Okay, Srotas, considerations. So again, Srotas involved, we have to try to work out the Srotas involved. And remember, each Srotas has got two roots, Mula, they are called as Mula. They are very important, which are the organs related with the Srotas, assessment of the srotodushti lakshana, the type of the srotodushti. Based on that, we assess the sadhya sadhya, that is the curability or difficulty to manage. Now, before we go into the activity, why this is important? Dosha and rasa relation. This is a simple formula that every one of you has to remember. Okay, if you want to develop the Samprapti Ghataka and plan the treatment, we know that there are 3 doshas in Ayurveda and only 6 rasas. Out of these 6 rasas, 3 increase a particular dosha, 3 decrease a particular dosha. So Vata, Madhura, Amla, Lavana will alleviate it. Tikta, Katu, Kashaya will increase it. Now this is the same thing that you have to use in your analysis of Nidana, etiological factor. When you are taking the patient's history of ahar, food that he is consuming, if you are able to note down which tastes are consumed much or in excess, then you can work out that it causes Vata, Pitta, Kapha, etc. Similarly, Pitta, Madhura, Tikta, Kashaya, Amla, Lavana, Katu will increase it. Kapha, alleviating rasas are Tikta, Katu, Kashaya, and aggravating ones are Madhura, Amla, Lavana. Why this is important? When you plan the Srotas wise Chikitsa, you have to select whether you want to increase a particular. That's why I told you. Now, in the case of Parkinson's and in case of paralysis, you are not going to select the same rasas. You want to control Vata. There you have to select Madhura, Amla, Lavana. Here you have to stimulate Vata. There you have to give Tikta, Katu rasas combined with other medicines. So that is why you need to work out the rasa combinations. Next, dosha, dhatu, mala relations. Vata is closely related to asti, bone. Pitta to rakta and sweda. Everything else is related to kapha. Okay. Now here there is a very interesting phenomenon that you have to note down. If pitta increases in the body, rakta and sweda also will increase. They are directly related. If kapha increases, then rasa, meda, mamsa, majja, shukra also will increase. But this relation is not the same with asvata. If vata increases, asti decreases. This is a very unique relation between vata and asti. See, this is what is happening, say, for example, in osteoporosis. Age is increasing, bone is decreasing. Density of the bone is decreasing. So vata vruddhi is taking place, asti kshaya is taking place. Okay, so this relationship you have to remember. Why is this important? Because when you are treating one dosha or one dhatu, the corresponding dosha or dhatu will also be affected. So your analysis has to be correct, and you have to keep an eye on whether other components are being affected, whether there is an increase of any other dosha or the dhatu. So Srotas wise herbs. Okay. Now, when you are discussing this, so these are the different Srotas I have listed here. Prana, Anna, Udaka, Rasa, Rakta, Mamsa, Meda, Asti, Majja, Shukra, Purisha, Mutra, and Sweda. Okay. Now, based on this rasa combination, I told you, right? I'll just go back one more slide. Now, this is the rasa combination, right? And this is the relation of the dosha and the dhatu. Now, here, srotas wise, forget the first three, start with rasa dhatu. Rasa dhatu is related to which dosha? Kapha dosha. Okay. So if it is related to kapha dosha, which herbs are good for that? Srotas. Which rasa are good for that? Which will match?
Stringent, pungent.
No, when you say good,
Madhura.
yeah. No,
Madhuram
it's-
Lavam.
Madhura Amla Lavana will help to maintain the functions,
Yes.
whereas Tikta Katu Kashaya will either cause problems in that, or if there is a problem in that to Srotas, you have to select that rasa to treat it.
Yes.
Now, based on your understanding of different herbs, if you can think of any herb which is Madhur Rasa, can you name any herb which is Madhur Rasa?
Esti Madhu.
Esti Madhu. So Esti Madhu is good in Rasa Srotas. Has to be good. That is the logic. Okay. Rakta Srotas. Rakta is related to which dhatu, which dosha?
Pitta.
Pitta. For Pitta, which are good rasas to, suppose there is a person who has come with Rakta Srotas vitiation. There is a problem in the Raktava Srotas. Which rasa will you use to treat it?
Madhura.
Madhura,
Tikta.
Madhura, Tikta, Kashaya. Okay. Can you name any herb which is Tikta rasa?
Kalamega, Guruchi.
Kalam. Guduchi, Kalame. See, it's very simple, right? If you know this logic, then selecting the herbs will become simple. You need not follow everything that Acharyas have told. Acharyas have told us that if you follow this simple logic in your repository, in your pharmacy, if you have that particular herb with that particular combination of the rasa, if you give it, it has to work. And it will work. No doubt about it. Okay. So try to remember, that is why I gave you the table of the relation between the dosha and the rasa, so that you are able to work it out like this. So when a patient comes to you, start thinking which srotas, and that is what the whole idea of developing the samprapti ghataka is. I told you that once you develop the samprapti ghataka, treatment will automatically manifest itself. Okay. Now, first activity. These are the symptoms. Okay. I hope everyone can see the symptoms.
Yes, Dr. Aakash.
Okay. And then I have given some questions. So if you can work it out, either you can write it down, or if anybody wants, you can just take a couple of minutes to work it out. For each symptom, write the dosha and write the subtype of the dosha. Each symptom. Then try to think which guna or karma of the dosha is affected. Forget about dravya for the moment. Just concentrate on guna and karma, quality and action. And then based on this, for each symptom, can you write down the srotas? And out of those 4 srotodushti that I told you, there are only 4 possible impairments. Can you write down those? Okay, are you able to work out? Okay, quick. Let me ask questions. In the head region, right? Headache. Can you name the subtypes of how many doshas are there in the head region?
Vata and Kapha.
Vata and Kapha. Okay. Which kind of Vata and which kind of Kapha are there?
Pranavayu would be
I'm
there.
confused.
Pranavayu.
Antarpaka kapha.
Okay. Any other Vayu in the head region?
Udana.
Udana. Yes. Prana, Udana, and one more Vayu.
Yan.
Piano.
Vyana Vayu. Vyana Vayu, because it moves everywhere. Okay. Tarpaka Kapha. Any other Kapha?
Yes.
In the head, Bodhaka.
Bodhaka, and one more.
Tarpaka.
Tarpaka, Bodhaka, and
Slash.
Shleshaka, because there are multiple
Shlash.
joints, right? There are a lot of joints there. Any Pitta?
Yes.
Alochaka.
Alochaka, and
Sadak.
Sadhaka is in the Hridaya. Okay. Any other Pitta? Which Pitta is in the skin?
Ranj.
Brajak.
Brajaka.
Rajak.
Brajaka Pitta, right? So you see, when somebody comes to you with a headache, you have to think of all these things. What is causing the headache? Whether Vata is the cause, Pitta is the cause, or Kapha is the cause. Okay. Now constipation is there. So in constipation, which dosha predominantly caused by? Vata. Which subtype of Vata? Apana. Apana Vayu. So constipation is due to vitiation, or which quality of Vata is impaired here?
Ruksha. Chala.
Ruksha guna is increased, so Chala guna is decreased, right? Okay, so constipation is in which srotas?
Annava. Vishwasa.
Purishava srotas. Okay, so you note down in front of each symptom. I have written the time frame or the duration of the symptoms. Okay. Based on this, can you tell me which is the first dosha to get impaired? Where did the first vitiation begin?
Digestion.
Which srotas?
The Anavaha Shrotas.
Which dosha?
Pitta.
Pitta dosha.
Pitta. Which Pitta?
Pachak Pitta.
Pachaka Pitta. Okay, because of that, what happened?
Digestion is impaired.
Leading to?
Ama formation.
Ama formation.
Burning
Leading,
sensation and epigastric pain.
Yeah. Then leading to?
Vata vitiation.
Yeah. Obstruction in the srotas.
Yes.
Leading to constipation.
Mhm.
Yes. So apana vayu should generally move down or up?
Down.
Downwards.
So here, in case of constipation, is it moving down or is it moving up?
Changing direction. Up.
It is changing
Upwards.
direction, right? It can go up to the region of the head.
Yep.
Yeah. And because of impaired digestion, over a period of 7-8 months, the patient is feeling weakness. This is a dosha lakshana or a dhatu lakshana?
That.
Dhatu.
Which dhatu?
Rasa.
Rasa.
Rasa dhatu. So which srotas have you written down now?
Rasavaha Shrut.
Started in which srotas?
Anavaha.
Start is Anavaha.
Yeah. Then involvement of Purishavaha. Okay. And then
Rasavaha.
Rasavaha, right? Okay. Now, which is the kind of srotodushti which is happening? What impairment?
Sangha.
Starts with Sangha, then
Vimarga Gamana.
Vimarga Gamana. So there are 2 srotodushtis which are happening, right?
Yes.
Am I right? Okay.
Yep.
Now, if you want to treat this patient, now suppose this patient goes, you see, headache is 1 week. The patient will come to you and say that I'm having a lot of headache, right? Headache is a presenting symptom because that is troubling him. If he comes to you, if he goes to another physician, they will give a painkiller or analgesic. Can you give that in Ayurveda?
No.
No, right? Here, if
No,
a
no,
patient comes to you, with headache, what you have to relieve? That is due to apana vayu, which may be due to apana vayu, which is climbing up. So what you are supposed to do here? There is Sangha, there is Vimarga Gamana. What is the treatment protocol you have to follow? What you have to do?
Lower the obstruction and open the channels so that they can move properly.
Yeah.
In the right direction.
So which herbs will you select? Which rasa will you select first?
You could
To remove the, tell me the rasa and then the herbs.
Will deepen something to improve deeper and packing.
Yeah, but which rasa will you select? Which taste?
Kashaya.
Why kashaya? Kashaya will increase vata or decrease vata?
Increase.
Increase.
So the constipation will increase, right? If you give kashaya, because kashaya is obstructing. Already there is obstruction. You need to push the vata down, right?
Madhura rasa.
Amla Madhura.
Amla Madhura you can give. But if there is ama, can you give Amla Madhura?
No.
No.
So for ama, which will be the best rasa?
Katu
Tikta or Katu.
Tikta or Katu. Now already there is burning sensation. Can you give Katu?
No.
No. Which is the best rasa?
No. Tikta.
Tikta. Why? Because Tikta is Shita.
Okay.
So you need to break it. So give Tikta rasa, but don't give excess Tikta, because by giving Tikta, Vata will increase. Okay. So if you are going to give Tikta rasa, what should be the Anupana vehicle that you can give? So that Vata doesn't increase.
Ghee
or
milk.
Any other thing?
Hot water.
Warm water. Of course, there is burning sensation, but Tikta rasa with warm water, we'll see that Vata doesn't aggravate, or ghee also can be given so that Vata is pushed down. Okay. You understand how the Samprati Ghataka works now. Writing down the Samprati Ghataka will point you towards the selection of a herb, selection of the taste of a herb, and what action you need to achieve. Now, suppose you have to give dietary advice to this patient. What will you ask them not to eat?
Avoid, Guru Guna are like fermented breads and all.
Yeah. So you see, once you understand which dosha is affected, then if you have a chart with you of dosha aggravating foods or dosha vitiating foods, whatever you have, you can easily tell to that to the patient. So working out the Samprapti Ghataka will actually point you to the direction of the treatment protocol very easily. So here you see there are more than one dosha which is involved. The gunas of the dosha also you are able to work out. The srotas you are able to work out. and the type of srotodushti. Now here in this case, you saw that there are two srotodushtis. One is Sanga, one is Vimargagaman. So if you write that down, then you will know exactly what you have to do. By breaking the Sanga, if you are able to push it down, well and good. Otherwise, you decide what you need to do first. You do this, then you do that. And this is the reason that we can tell the patient that, look, this is what is happening in your body. And we need time. It is a stepwise process. We cannot do everything at once to you, because then it will be antagonistic to the outcome. So you need to give us time. And most importantly, in Ayurveda, please remember, the patient is an active participant in the treatment. They have to follow your advice. They have to follow the routine that you tell them. They have to follow all the precautions and everything that you write. Also, one more thing that the Samprapti Ghataka will point out to you is, in Ayurveda, we have this beautiful concept of Bheshaja Kala, time of administration of medicine. Okay, very beautifully they have described. How is that decided? Based on which dosha have written down. For example, constipation is by Apanavayu. Okay, or do you remember, if there is Apanavayu vitiation, at what time the medicine should be given? When the medicine has to be administered?
Before meals.
Before the meals, right? So you will know exactly. If you write down these things, then what we are trying to do here, we are just trying to follow the principles of diagnosis. If you are able to write down this Samprapti Ghataka for every patient that you see, then it will automatically come to you the next time that you see. If you have 10, 15, 20 patients, if you do this, then all these things will fall into place and you will start thinking like that. And it is not difficult to do that. You are not compromising on the principles. In fact, it will make your principles more clearer. Okay, so I hope you understand what I'm trying to make you do here by writing down the Samprapti. Why understanding and clinic, any disease for that matter, any disease, if you can sit down and work this out. One more thing I will tell you. So here, this is another patient that we had. 40-year-old female presents with the following: burning sensation in the feet, low appetite more than 6 months, headache on and off for about a month, low backache for 3 weeks, and irregular periods and reduced flow since 6 months. So can you write the Samprapti Ghataka of this case? So Dosha, Dhatu, Srotas, Agni, similarly. Any case which comes to your clinic, anything, just try to work it out. So make a chart. I would suggest keep some printouts of the Samprapti Ghatakas, so that as the patient comes and sit with you, and once you take your history, just fill in the columns. And that will point you exactly to the rasa you have to select, the herb you have to select, the formulation you have to select. So we have to go to that level. Sometimes you can mix and match the herbs. Acharyas have given us that liberty. It's not that we have to blindly follow them. What the Acharyas have told us is, if you don't get all the medicines, forget it. Follow the rules of Dravya Guna, Rasa, Guna, Virya, Vipaka. Mix and match and give it to the patients, and they have to improve. They will improve if you follow all these principles. But to follow those principles, we need to write down the Samprapti Ghataka. Because the definition of chikitsa, that is treatment, is Samprapti Vighatanameva chikitsa. Breaking the Samprapti is chikitsa. And if we don't understand Samprapti, then we will never be able to break it. Otherwise, what is the difference between another physician and us? We should not become symptomatic physicians. We are not here to treat symptoms. By addressing the symptoms, sometimes in Ayurveda also we are faced with the challenge of, when a patient comes to us with particular symptoms, that symptom can be so debilitating that initially we have to give symptomatic relief to the patient. Otherwise, they will not follow your further protocol. So we have to do that in some cases. But in all other cases, in the present day clinical context, look at all the lifestyle disorders, what are called as non-communicable disorders. They are not emergency medicines. They don't need emergency treatment. They need this. They need the Samprapti Ghataka. They need a proper plan. And please remember, one of the questions asked was, how long should we give treatment for? This is a rule that we follow in our clinic. it is not important that the patient gets better. It is important that the patient stays better. Okay, this is a very important differentiation you need. The patient will get better with your treatment, no doubt about it, if you follow this protocol. But staying better is a patient responsibility, and staying better should be without medicines, only on diet and activities. So as a physician, our duty is to empower the patient, to tell the patient, look here, now I have got your disease under control. I'm going to wean you off some medicines over a period of time. I'm going to taper them off, but it is now your responsibility to stay better. Because as long as the patient takes medicine, they will stay better. You know, as a physician, as a doctor, it is good business for us, right? Every month we need the patient coming back, refill the medicines, we can keep business out of it. But that is not what the whole idea is. That is why I told you in the very first session that the goal of Ayurveda is to establish equilibrium. Acharyas do not want us to keep on treating patients for their lifetime. Acharyas want to tell us that treat them and put them on the path to health. And it is their responsibility. That's why I told you patient is an active participant in Ayurveda treatment, and then follow it. Okay. So I hope you are able to follow this, right? The activity number 2 that I have given. Are you able to work out? Very quickly, can you tell me where the symptom started? What is the first cause, or way in which srotas the symptom started?
Agnimanda.
Agnimanda, right? Agnimanda leads to what? So if you see a low appetite and irregular periods, can you tell me the relation between low appetite and irregular periods?
Vata Vritti.
Vata
Vata Vritti.
leading to? Leading to what?
Rasakshaya.
Rasakshaya. How is rasa related to periods?
It's one of the, is it the Upadhatu? Yeah.
Upadhatu, Artava, right? Artava. So here you see it is in the Artava Srotas, started in the Annava Srotas, Rasava Srotas, Artava Srotas. So for here, if you want to set this patient right, so patient has got irregular periods and reduced flow. So Rasakshaya Lakshanas are there. It is a Rasakshaya Lakshana. So Rasakshaya Lakshana means you have what you have to do here, you have to do nourishing treatment. So this may be a case who has here I have written a 40-year-old case. Today we are seeing more and more cases of PCOD and PCOS. All of them have got these irregular periods and reduced flow. So how do you assess that? Assessment is based on this. So your treatment should be to improve the Agni so that nourishment is improved. And once nourishment is improved, the periods will automatically set right. If you give any, can you give a medicine to just to stimulate the periods here? Will that help?
No, not really.
It will not help, right? You are not helping the body at all. So you have to establish the equilibrium so that if rasadhatu is formed, automatically artava is formed and periods will become regular. Isn't it? So look at the modern way of treating. For example, somebody has come with excessive bleeding and PCOD, etc. In modern science, they give hormonal treatment. Hormonal treatment is a way of telling the body, okay, you shut down your functions, let the medicine do the work. So it is in fact causing more problems. But our approach has to be different. And our approach is based on working out the Samprapti Ghatakas. Right? So I hope you understand the importance of writing down the Samprapti Ghataka in each and every case that you get. See, in Ayurveda, we have got, and the reason I tell you that is because in Ayurveda Samhitas, there are diseases given in the chapters, but they are single diseases. In clinical practice, the reality is that we do not get a patient with a single disease. Yes, we do get sometimes. Let us say that there is a patient who has got hypertension, who has got diabetes, who also has hypothyroidism, but he or she has come with some other complaint. Now, where is this described in Ayurveda? Is there one single chapter where all these things are described? No. We don't have this. So how do you understand that patient then? He has got hypertension also. He is already on modern medications. His blood sugar levels are out of control. Plus he has got other symptoms. Plus they are on thyroid medications. So how do you work it out? The only answer is to work out the Samprapti Ghatakas. Write down the dosha, dhatu, srotas, etc. and try to assess and think. Can you stop those allopathic medicines? Should we stop those? Or can we work around those? Will our medicines, because ultimately the question asked will be, will our medicines interact with the allopathic medicines? Will they cause, drug interaction, whatever it is? So we need to answer those. And to answer those, we need to understand what is happening in the body. Because today it is a reality, in our clinical practice for the last 5-6 years now, what we are seeing is we are treating more and more number of cases because of the side effects of allopathic treatment. And they are mimicking diseases. That is the reality now, clinical reality. So unless we don't know, so therefore, please, brush up, read what are the side effects of the common medicines taken by people in allopathic treatment. Simple example I'll give you. Let us say that we had a patient who came with severe cough, dry, irritating cough. Okay, and this patient had gone to all the doctors plus 2 Ayurvedic doctors also. They have tried everything. Nothing has worked. The patient did not find any relief. And then we were the 3rd Ayurvedic doctor that they came to. So we have to analyze it now. When we took all this history, then we were thinking, we analyzed, and then we found out that this patient was hypertensive and he was put on a particular antihypertensive. Now, when we read the details of that particular antihypertensive causes one of the commonest side effect of that is dry irritative cough. So, for example, in Ayurveda, we give Sitopaladi and Talisadi Churna as a treatment. Suppose we give that to this patient. Do you think the symptom will be controlled? No. Why? No. Because the etiological factor is consumed by the patient every day. He is consuming that tablet every day. So we had to write a letter to his physician that please change this medicine. And as soon as the medicine was changed, the cough stopped. We didn't have to give any treatment. So you see, please remember, in Ayurveda, whenever a patient comes to us, it is not mandatory that we have to treat everybody who comes to us. We have to decide whether they will get better only by diet, only by activity, or sometimes, like I told now, by altering the medications. And therefore, we have to do a complete and detailed analysis. It helps to go through all the details so that we are able to form an informed decision and help the patient or guide the patient to a better option. Okay, this I think is a part of the activity only. Based on the Samprapti Ghataka, the 2 cases. Any case in your clinic or any patient that you have seen, try to work out on these every day or whenever you get the time. Write down the choice of rasa that you would select and again answer why. Write down the type of formulation. That is also very important because not all formulations can be given in every patient. You have to select the formulation also. For example, let me ask you, if there is a patient who has come with diabetes, his blood sugar levels are high, which formulations you cannot give him or her? Which type of medicine cannot be given to them?
Anything containing sugar, like Abhipatakara Churna or Sitopaladi Churna, that kind of thing.
Yeah. Okay. Then anything else?
Lehyas.
Hmm?
Lehyas.
Lehyas, yes. Anything else?
Majorly Madhur Gunatmak or Rasayana category.
See, Asava and Arishta also contain jaggery in them. Most of the fermented preparations are made with jaggery. So if you cannot prescribe them, right? So what you can prescribe them? What you are allowed and you can freely prescribe?
Churna.
Churna without sugar and kashayams.
Swarasa. Mm-hmm.
Swarasa you can give and kashayams you can give. Swarasa may be difficult because for that you need fresh herbs. So if you're able to get fresh herbs, well and good. Otherwise, the best option is to give kashayams. So, when you write down the Samprapti Ghataka and the other possible things, you should also be able to write down the formulation that should be given and should not be. Now, suppose there is a child who has come to you. Now, for a child, can you give kashayam? No, he will not take it, right? So, for the child, all the medicines have to be in the form of a electuary, leham, or something which is palatable. Now, if there is an old patient, let us say there is a patient who is 70 plus, what is the first thing that should come to your mind when you're prescribing? Just straight off the head, what is the first thing you'll think of? 70 plus patient.
Easy to swallow.
The competence of their kidney isn't as good as the rest of the younger people.
Okay. Anything next?
Digestion is lower.
Okay. Then
should be easy to take.
Yeah. Then
they're in Vata state of life, so Grita is good.
So they are in Vata stage of life, plus all the other things that you said. So what is the first thing that you have to do? Your medicine should not do further depletion of the dhatus. So one of the components of your chikitsa should be to give as a Brahmana chikitsa, or to nourish, or to at least maintain the status of that patient. Okay. So these are some important things offhand, you should remember when the patient is sitting. As soon as you write down the age, think of this. As soon as you write down the symptoms, start thinking. So please follow the principles of writing the Samprapti Ghatakas. Okay, some other examples I can discuss later. Should we take a break? It's the next, is it the lunch break now? Is it time for lunch break?
Yes, Dr. Aakash, well remembered, yes.
Okay.
Carolina, remind us, is it 1:50 that we come back?
So let's take 25 minutes from now.
Yeah, so 25 is now
1:45 or something. 1:45.
Before we move too far from one of the examples, can I just ask a related question that I typed in the chat? About the burning hands and feet that was in the second example.
Yes, we can find it quickly.
So I just asked when with that patient situation with the burning hands and feet, is that coming from the Rasakshai, like the Vata, the Vyanavayu?
Yeah.
Carrying this Tikshna.
This is right. This case, right?
Yes.
Yeah.
Can you say more about the burning sensation in the feet in this situation?
Yeah. So the burning sensation in the feet, like you worked out, one of the options could be due to Rasakshaya. Because of Rasakshaya, there is a Dhatukshaya. Whenever there is a Dhatukshaya, which means that there is no proper nourishment of the dhatus, which can manifest as a burning sensation. That is number one. Second component or second reason could be, here we discussed that there is an involvement of the Artava. Okay. Now, Artava and Shukra, you know that in Ayurveda there are two components, Shukra and Artava. In Ayurveda, we look at the body as being made up of what? Two components. One is called as Saumya, the other is called as Agni. The cool, what you call as the, I don't know how to put as Saumya, that is a cooling.
Yeah, cooling principles.
Principle and heating principle. So Artava is what? Is it heating or cooling?
Heating.
It is heating. So there is an impairment of the Artava. Artava is related to Rakta also. Rakta is related to Pitta also. Now, because of that vitiation of the Vata, the Pitta in this Artava related component is getting affected. Because remember, Vata can take Pitta and Kapha and can produce other symptoms. So this burning sensation in the feet, it could be due to that. The third and another simple logical explanation could be that now the patient is 40-year-old, they got burning sensation in the feet. This is a Purva Rupa of
like perimenopause, of
premenopause or of Prameha.
Of Prameha.
Prameha. Okay. Now I have not given all the other details. I'm just telling you, if the patient is obese, if the patient has got other symptoms, if you are suspecting, so if they come with burning sensation in the feet, Hastak Pada Karadaha is a Purva Rupa of Prameha, is a premonitory symptom of Prameha. Okay. So if you assess that, if you analyze that, and if you do a simple test, if you rule that out, then other things can be treated. So if you take it all these, if you analyze all these details, and if you rule out, say Prameha is not there, then you start treating Vatakshaya. So again for Vata, so Vata Vruddhi is there. So for Vata Vruddhi, you are using Madhur Rasa. See. So if you want to treat this patient, there is Vata Vruddhi. Madhura, Amla, Lavana are the Rasa you have to use. But there is burning sensation. Can you give Amla and Lavana? No. So you have to give Madhura. So give Madhur Rasa. It will improve the burning. So again, This is, I'm talking only in terms of burning sensation, because before that we have to tackle the appetite and other things. So initially you may have to give something. The next step will be that. So suddenly at one time only, if you give all the medicines, again that will not act, because already the patient has got low appetite. First improve the appetite, let the digestion improve, then you give Madhur Rasa, because Madhura is heavy for digestion. So these are the possible causes of burning sensation.
Great, thank you so much.
Thank you.
Great. Dr. Aakash, I think in that case it's now 1:27, so we could meet just after 1:50. Yeah, 1:50, 1:50, 1:52.
Okay, no issues.
Okay. Carolina said let's make it 1:55. So
basically a 20 minute, 20 or 30-minute break, or 25 minutes?
So it's like
minutes.
25 minutes from now.
25 minutes. Okay, fine.
Great.
Great.
See
One
everyone
thing can I
soon.
ask? Sorry, one thing can I ask? Sorry.
Yeah, sure.
Yeah. So I'm considering this patient in this activity too.
Hmm.
So just one medicine came into my head. I don't know if that's relevant or not. So Panchtikta Ghrita Gugul, if we can use her.
Yeah, you can give.
Considering Pitta and Vata both, it's a Grita preparation and so that can control all the Vata and heating sensation and the Pitta.
You can. Yeah, because low backache, again, Rasakshaya, again, yeah. Definitely you can give. You can give.
Okay. Okay, sir. Thank you. That's it. Okay.
Thank you.
Thank you, sir.
Great. See everyone at 1:55. Enjoy your lunch.
Thank you.
Wonderful. Welcome back, everyone. Welcome back, Dr. Aakash.
Thank you, Colette. Can I start? Is everyone back?
Yes, we hope so. Dr. Aakash, we've got a few more questions. Do we do them now or a bit later on? Do we first continue this?
I think we can do it now. And then
Can I ask a question? I was not able to unmute myself earlier. It was a continuation of the earlier question about the how long we can take medicine. So we have seen like a pattern of like 21 days or doing 9 days medicine, giving herbs like that. So you mentioned about we need to give like rasayana kind of preparations as a protection. So for example, people like thyroid complaints, we have to give continuously medicine for. So is there any guidance from your side for protection of as a part of Dhatu Samrakshana? What can we do best?
Yeah.
Thank you.
In terms of rasayana, many medicines that you give for a particular treatment of a disease, sometimes we can choose the formulation such a way that initially they will act as roga shamaka, that is, they will alleviate the disease. And then if you continue it later, they will act as a rasayana also. Simplest example I can give is because you raised the point of thyroid or hypothyroidism. Now these patients will be already taking the medicines of thyroid hormone. Preparations will be given, the thyroid hormone or whatever. So in those patients, say for example, if you put Chandra Prabhavati, so Chandra Prabhavati will act on both thyroid issue also, Dhatwagri level, plus it will act as a rasayana also. And that you can give continuously, say for 3 months or 6 months. Then there is no harm in giving that medicine along with it. Now in Pranava Srotas diseases, let us say somebody has come with asthma or chronic bronchitis or some kind of these kind of things. So initially you treat the condition, and then as a rasayana, you give, for example, Agastya Rasayana. Agastya Rasayana is a Vyadhihara also, plus it is a Pranava Srotas Rasayana also. And because it is in the form of a leha, this can be given continuously. There is no harm. So whenever you prescribe these such kind of medicines as a rasayana chikitsa, please select formulations which are based either in Ghrta or you give Anupana as Madhu or some Leha preparations. And then there is no problem of continuing it for a longer duration. But if the patient is diabetic, then only Guti Vatis can be given, or Kashayams, for example, generally we avoid giving them for a longer duration. As soon as the symptom is under control, then you can give it. But there are again some Kashayam. For example, there is a Kashayam called as Ashtavarga Kashaya. Now, Ashtavarga is a Brahmana medicine only, so that can be given. Now, another additional formulation that we are having in the market is most of these Kashayams are converted into Kashaya tablets. So in a way, they are adding on to our therapeutic usage, and you can give them. For example, Ashtavarga Kashaya tablet is there, and many other Thaila preparations are coming in capsule filled preparations. So you can use them. So there is no harm in giving it. Only in certain medicines, if you are using Tikshna Dravyas, Ushnavirya Dravyas, in those preparations, you have to be careful as to how long you are giving it. Keep observing the symptoms that the patient will manifest. And if there is any slight indication that the patient is reacting or something else is going wrong, you have to immediately arrest it and change the medication. So generally, as a rule, in our clinical practice, what we follow is one or the other kind of like a Nitya Virechana Dravya is advised. So that there is proper Vata Anulomana on a regular basis. Nitya Virechana is done so that there are no side effects of the medicine that you are giving. These are some simple rules that we follow.
Yeah, so I have seen, from traditional practice of giving Triphala for. So what I'm concerned is it will cause like Satmyada for people, right?
Sure.
So so how can we avoid because I'm a practitioner who tried to reduce. I use very minimum herbs. So what I do is give herbs for 3 months and then give a gap of at least 1 month and then continue again. Yeah. So that's what I'm doing. So I'm just here to ask if there is any other solution for chronic condition. Giving, it's like more than 6 months or something. I'm not comfortable.
No, you can give. There is no doubt. There is no harm in giving these medicines. But especially like you said, with Triphala and other single herbs that you are prescribing, they can cause Satmyata also. But because also, what you have to also understand is whether the patient is taking these medicines as instructed by you, whether they're following the preparation of the formulation, the Anupan, etc., the diet, etc. All that has to be verified and monitored correctly. But tablets, Gutis and Vatis, that is also a simple rule that we follow, that don't give it for more than 3 months. Within 3 months, you should be able to see the desired change. If required, then you stop the medication. In between, what we do in our clinical practices, you give some Agni-Vardaka Dravyas, like Kalamega, Bringaraja, or Bhumyamalaki. These medicines themselves will act as Agni-Vardaka and Ama, whatever Ama, even if there is Ama which has been created by the overuse of medicines also, that can be countered. So 3 months is a good time to continue the medicines. Give a gap of at least 3 weeks after that. But in those 3 weeks, give some Agni-Vardaka, Deepana Pachana Dravyas, and that can be advised in the form of Ahara also, and then restart the medicines. So there will be no harm.
Thank you. And is there any reference for because we do like follow up after 21 days, something like that. So I'm just curious.
That reference is there in Rasa Shastra. One mandala, it is not actually 21 days, it's 48 right. days. Yes. It is 48 days. That is called as one mandala. Yeah. So many Rasaushadhis are given for one mandala. 48 days you can give without harm. But again, underlying factor is that the medicine should be properly prepared according to classical text. Then you can give it no harm. Absolutely no harm.
Great. Thank you.
Thank you.
Right. Thank you, Dr. Aakash. So I will start with a few questions.
Yeah.
So it's a question from Kate. If you can explain the difference between Vyaktisthana and Adhisthana.
Yeah. Okay. Again, simple example here is let us say somebody is coming with Pratishaya or running nose. Now Adhisthana is Shiras, Vyaktisthana is Nasa, that is the head. The location of the disease in the region of the head. Vyaktisthana is where the disease actually manifested. Now, in some diseases, both Vyaktisthana and Adhisthana can be the same. For example, if you're writing the periphery, Shakha, that can be the Adhisthana. but a manifestation can be in the hand or in the skin. So that way we can write it. In certain diseases, in some diseases, the Vektasthana, for example, the head and neck region is a complex area where many organs are there. But the entire region, we call it as Shira Pradesh, Shiras. So there the Adhisthana will be Shiras, but the manifestation can be in the eyes. For example, Netra. Netra can be the Vektasthana, Adhisthana can be in the head. Why this is important is, when you are treating when you are giving medicines, you also have to consider that the Adhisthana should not be disturbed. That is also important, because even every organ, for example, Amashaya, in Amashaya there is Kapha, in Amashaya there is Pitta, in Amashaya there is Vata. All three are there, but the resident dosha is Kapha. So when you are giving the Chikitsa, the resident dosha should not be disturbed. If for that reason, we need to write down Adhisthana and Vektasthana. In certain areas of the body, they can be the same. In certain areas of the body, they can be different.
Thank you, Dr. Aakash. So the next question is again from Kate, and it's related to the doshas we described in the earlier slide. So how much do you use subtypes of the dosha in practice? And alongside, she's asked, Dravya often aren't described in terms of which subtypes they act on. So does it materially change choice of Dravya? And could you give some examples, please?
Yeah, like I told you now, I'll give a simple example of constipation. Now, Vata Gunas are applicable to all the subtypes of the Vatas. So when you analyze the subtypes of the dosha, for example, here in case of constipation, we say that it is Vata, but again the subtype is Apanavayu. The reason we analyze that subtype of dosha is, one, to select the Bheshaja Kala. The second thing is to do with the kind of medicine you want to prescribe. Now, suppose Apanavayu is Udavartita, that is, if it has become in an upward direction, if it is moving upwards, you need to push it down. So in those instances, we have to give Madhur Rasa or Lavana Rasa, because Lavana Rasa is also, that is why most of the laxatives used in Ayurveda have all the types of Lavana. Pancha Lavanas are always used, because it will increase the secretions and it will push the Vata down. Now, in certain instances, we have to give Amla Rasa Dravyas in certain conditions of Vata. So the analysis of subtypes of Vata or Pitta or Kapha helps. Now, if there is a skin condition, it doesn't help only if you know that there is a Pitta. It helps if you know that there is Bhrajaka Pitta involvement. Why Bhrajaka Pitta involvement is necessary? Because if you analyze the function of Bhrajaka Pitta, it is to absorb the medicine and the virya of the medicine. Now, in such instances, if you are giving medicines to be applied externally, and if the Bhrajaka Pitta is vitiated or it is obstructed, then your medicines will not be absorbed internally. So you have to clear that obstruction first, so that the medicine will be working better. In those instances, we have to give medicines first which will clear the Pitta, which will stimulate the Pitta, so the skin starts getting clearer. Then when you apply the medicine, it will be absorbed. So yes, in clinical practice, we do use the Amshamsha Kalpana to analyze the disease, and the medicines used are also based on it. For example, Vanavayu. So Vanavayu is invariably involved. You see, Vata, for that matter, is invariably involved in all the disease, because without Vata, nothing happens in the body. And amongst Vata, again, Vanavayu. So Vanavayu is important. So if you are giving medicines for Vanavayu, because all the gati in the body is by Vanavayu. Now, suppose there is a patient who is having anemia or Pandu. Now, in Pandu, there is a Rasa Rakta circulation is impaired, and Rasa Rakta circulation is impaired because of the impairment of the Vanavayu. So if you want to treat Vanavayu, again you have to look at the Mula of the Srotas. In Pandu, Hridaya is involved. Rasava Srotas, Mula is Hridaya. Now Hridaya is the son of Vanavayu. Okay, so Hridaya is the son of Ojas also. So whatever medicine you give has to work in conjunction with that. So yes, we do analyze Amshamsha Kalpana, we do Amshamsha Kalpana, and we do select the medicines based on that. Amshamsha Kalpana helps in establishing understanding the Bheshaja Kala, number one, and whatever medicine you give has to work on that dosha. So you have to analyze the guna involved also. That is also important.
Thank you, Dr. Aakash. Kate is also asking, with the example that you gave of paralysis versus Parkinsonism, which you said paralysis is a rare example of us treating Vata Kashaya Lakshana. i.e. actually kapha vriddhi, or has she misunderstood?
See, when you say there is vata kshaya, it necessarily need not mean that there is kapha vriddhi. So this is a general impairment of the vata itself. Kapha necessarily need not be increased to cause vata kshaya there, because of the derangement and other factors which are unknown. Here you have to take into consideration the what you call manoha srotas. In the manoha srotas, there is sattva, rajas, and tamas. So if you look at the samprapti, which is there of unmada and apasmara in those two diseases, so there you will see that the manoha srotas getting affected by certain factors, and because vata and manas are closely related, and certain individuals are more prone, like I said, they are more predisposed. So not necessarily kapha increase causes Parkinsonism. It may be the cause, but not necessarily always be the cause.
Wonderful, Dr. Aakash. I think that's everything. I just had a question.
Yeah.
If you could repeat, you mentioned to Raishath the Agni Vardaka herbs, and you mentioned Bhumi Amalaki, Bringaraj, and there was a third one.
Kirata Tikta you can use, or Kalamega.
Kalamega. Okay, great. Thank you. That's everything from everyone.
Okay, thank you. So let me just, what remains is just a few cases that I want you to take. So these are images of the patients that we have seen. Yeah. Now this was a patient who came to us with this presentation, and he has been to modern doctors, and they had advised him surgery. So immediately when you see this, can you tell me what you see? What is your thinking? This is a 75. This was a 75-year-old male who came to us. What is it that you're seeing, and what exactly you're thinking? Can you immediately think through the samprapti ghatakas and tell me what exactly are you thinking now when you see
There's
this case?
some ruksha.
I think it's the patella. Yeah. And it looks like there's a swelling in the bursal sac, which is on the infrapatellar bursa.
Okay.
It could be due to arthritis. We don't know anymore because we don't know whether the patient's experiencing pain.
Yeah, there was pain. And if you see this photo of from the side, you can see that the knee joint is not touching the the bed, the examination bed. So he's not able to completely extend the knee.
It could be. It could
be
a Baker's cyst in the jatru mama pushing down.
So what comes to your mind immediately when you see this? There is inflammation, right? It indicates inflammation.
Yes.
Okay. There is pain there, and there is swelling. Inflammation, pain, and swelling. Of course, these are all the classical features of inflammation. Now, whatever the underlying cause may be, he has gone to all orthopedic surgeons and everything. They have given him antibiotics. They have given him analgesics, NSAIDs, but still there is no relief. And lastly, they said that there is a lot of fluid collection, so we have to do surgery. But he was 75-year-old and he didn't want to undergo surgery, so he came to us. Okay, so now just looking at this, can you tell me what treatment principle you want to do here? What is the principle? Not the medicine or not the herb. What you want to achieve here?
Reduce the swelling first.
Reduce the swelling.
And inflammation.
And inflammation, right? Yeah. So he's a 75. Yeah. So he's a 75-year-old person, right? So, and he was very fragile and physique can see. So, what form of treatment do you want to give only internal treatment or local treatment also?
Local treatment.
More of local treatment, less of internal. So we decided we will give less of internal treatment and more of sthanika, that is sthanika chikitsa we give. So local treatment, can you do snehana and svedana here?
In the Sweden, maybe.
Yeah.
So much.
Okay. So if you just look at this, the date here, 1/1/2016, this patient had come. In one of the photographs, it's clear, right? So we started treatment, and this is what is the treatment on 13/1. It is, I think it's missed here. So you see the relief. Yes. You see the changes within just 10 days. no surgery was required. You can see the swelling has reduced, the redness has reduced, and the skin color has almost come to normal. So we did only local application with the Dashanga Lepa. And internally, we just gave him Yogarajaku Guru. Only 2 medicines for 10 days, and this is the result you are seeing. And you can see here the limb, the knee is touching the bed, the examination table, the bed. So earlier he was not able to do that. Now within just 10 days, you're able to do this. Okay. So this is how, once you look at it and when you try to formulate and think through, so you have to do the patient assessment. Then the age was taken into consideration. The previous history was taken into consideration. He has given so many antibiotics, so because of which he has developed gastritis also. He was more worried, and because surgery is very expensive, he didn't want. So when they came to us, we said, okay, fine, no problem. Within 10 days, with very simple medicines, we were able to give relief. Okay. So what do you see here?
Varicose veins.
Yeah. and what? What? Anything else you see?
Eczema on the feet.
Is it eczema or something
there is
else?
No circulation to the feet.
What do you see? What do you see?
Brawny edema at that, from the ankles to the end of the foot.
See here. Forget all the modern terminologies. Tell me in Ayurveda. What do you see? According to Ayurveda, tell me. Vata, Pitta, Kapha, Lakshanas, you tell me.
Vata Rakta. Raktavat.
No, that is a diagnosis.
You can see the discoloration that comes with Vata. I can't remember the Sanskrit word for that.
Okay, no problem.
The ambu is stagnant more in the left than in the right. Even.
I'll show you some other photos. Yeah.
It's
it's
also
very clear, right?
the wounds would be Rakta Dhatu and Pitta.
So what is happening here? What do you think is happening? Can you tell me the samprapti of this?
Sangha, some kind of Sangha.
Sangha of what?
Of the Rakta.
Rakta what?
Rakta Srotas.
Srotas. Srotas. There is Sangha of the Rakta Srotas. Due to what? Sangha due to what?
Obstruction.
Yeah, Sangha is obstruction, but due to what?
The veins, the anatomical.
The quality of the Rakta is not proper forming.
No, here it is because of the Sira Granthi, right? The 4th variety of the srotodushti, which is anatomical swelling, which is there. So one kind of srotodushti has caused the other srotodushti, right? Sira Granthi has caused Sangha. Now, because of that Sangha, what is happening here? The quality of the Rakta is decreased. So according to Sushruta, Rakta derives 5 qualities from each of the Mahabhuta. Israta, Dravata, Ragaha, Laguta, Spandana, Stata. So different qualities of Rakta are derived from the Pancha Mahabhutas. So here you can see there is discoloration in the feet. So this Rakta, now Rakta is related to which dhatu, which dosha? Sorry. Pitta. What is the moola of the Raktava Srotas? Root of the Raktava Srotas?
Yakrat.
Yakrat and Pliha. Which Pitta is present in Yakrat and Pliha? Ranjaka Pitta. Here, which Pitta is affected in the skin? Brajaka. So when you are treating, do you need to keep all these things in mind?
Yes.
And what will be your treatment protocol? How will you start treating this?
With the liver cleanse.
Yeah. With what rasa? Which herbs will you use?
Tikta.
Tikta rasa. Can you name some herbs which are Tikta rasa?
Guruchi.
Which are good for the Rakta also. So here you have to keep both in mind, Pitta as well as Rakta, isn't it?
Nimba.
Nimba, yes. Then?
Bringaraj.
Bringaraj, yes. Then?
Kalamega.
Yeah.
Manjista.
Okay, in what form will you give?
Kashaya.
Kashaya. Okay. Suppose the patient is not diabetic, then can you give Asavarishta?
Yes.
Okay. Can you name 1 or 2 Asavarishtas which are useful in skin diseases?
Kadira Arishta.
Kadira Arishta. Yes. Okay. So you see, when you write down the Samprapti Ghatakas and you note down the components, it will point you to the direction. Now here, do you want to give only internal treatment also, or do you want to plan external treatment also?
External also.
External as well.
So what will you plan externally? What treatment principle you will plan?
Jalauka.
Okay. Then?
It needs to be wound healing. So like, it looks like some wounds there.
What will you do?
I don't know.
How will you treat?
You need to purify the blood that's stagnant there.
How?
Remove impure blood.
How?
With Jalauka.
Okay, I don't have Jalauka. Then?
Cut it.
Would you do a wash with Kashaya Rasa to astringe, like to help close and heal the wounds?
Tikta Kashaya Rasa, you have to do what is called as a Parisheka. Parisheka or Avagaha, or immerse the foot in the water, in the decoction which you have prepared, which are having Rakta Shodhaka Dravyas. See, in Ayurveda, there are two things that we have. One is called as Rakta Shodhaka Dravyas, the other is called as Rakta Prasadaka Dravyas. So what is the meaning of Rakta Shodhana? Rakta Shodhana means there is ama in Rakta. So you have to purify the Rakta. What is Rakta Prasadana? You have to increase the good qualities in the Rakta. You have to nourish the Rakta. So here you start with Rakta Shodhana Dravyas, then go on to Rakta Prasadaka Dravyas. So ultimately later on, the treatment, by doing the treatment, the skin discoloration will change. But in case of varicose veins, because of this discoloration you see, cannot be easily treated. That is because of the stasis of blood, what we call as Sanga. Because of that, there are some pigments which come out from the blood, and that is what gives this typical appearance of this brownish discoloration. There is a pigment in the blood which is called as hemosiderin, which comes out, and that is a very high irritant. And because of that irritation, the patient itches, and because of that itch, the ulcer will develop. You see, when you see a case, so you have to know. Now again, here you have to advise diet properly. Lifestyle also is important. Okay, elevation of the foot is important. Creep bandaging or stockings, all these have to be advised. And when you want to know the prognosis, can you heal this? Can you treat this? Can you, suppose the patient asks you, can you cure this condition? What will be your answer?
No.
You can help ameliorate the symptoms.
Yeah. So you cannot cure it, right? Yeah. So that's what. So you are writing down the Samprapti Ghataka will tell you the prognosis also. So we should not promise something that we are not able to do. First, we have to be aware. Yes, this is the extent to which I can help. But provided you follow these things correctly, then the condition can be kept under control, because the occupation is important. Other factors are also important. Okay, this was one case that we treated. Now this is the complication of that case that we had. Okay, so you see, this is the further stage of that, not that patient, but some other patient. So this is the varicose ulcer. So you can see this is how the patient presented to us when he came. Again here you can see the skin has become very hard, brawny discolor, thickening, keratinization, lichenification, we call it as. So it has gone to that extent that you can see the depth out there, and then you can see yellowish tissue also, which is a slough, which is there. Okay. So now immediately when you see this, which dosha do you think is involved?
All three.
Yeah.
All three, right? Which is tridosha. Which dhatu is involved?
Rakta.
Rasa, Rakta, Mamsa.
Yeah. Rasa, Rakta, Mamsa. So predominantly three dhatus, and all the tridoshas are involved. Okay. Now, when you want to treat, which srotas do you think is this?
Raktavaha.
Raktavaha srotas. Okay. So again, same treatment principles you adopt. So we started treating this patient. He had gone again everywhere. Now these are very notorious because it's a very big wound, big ulcer. They will not heal very quickly. It will take time. Okay. So, but we started treatment and we were able to achieve this. Can you see the changes?
Yeah.
You can appreciate the change, right? The wound is healing well. There is not much slough. A lot of good granulation tissue is there, and the wound is healing well. Of course, it took a very long time for it to reduce in size, but this is what we are able to achieve with simple Ayurvedic medicines. No allopathic treatment, nothing. Only external treatment and internal treatment. Internal treatment, again, this varicose vein and these things, we treat it on the lines of Vata Rakta. Okay, we have to treat it on the lines of Vata Rakta. All peripheral vascular diseases are to be treated on the lines of Vata Rakta. And in Vata Rakta, please remember, the Gugulu of choice is Kashor Gugulu. or Amrutadi Gugul. Okay, Kaishwar Gugul or Amrutadi Gugul. And there is one beautiful Kashaya which works wonderful, which is called as Kokilakshadi Kashaya. So if you do these simple medicines and wound dressing, wound parishek, what we did was we started with irrigating the wound with a Rakta Shodaka Kashaya, Mandishtadi Kashaya, Asanadi Kashaya. You can select, or we, because we get all these leaves, neem leaves are available, karanja is available, turmeric is there. So many fresh things are there. If you bring and make a boil it and decoction, and then you irrigate the wound, and then you dress it up with some taila or ghrita. Initially, when there is slough, we don't use any taila or ghrita because taila and ghrithams are sticky, so they will increase the slough. So there we have to apply kalka. For example, neem. So we got neem leaves, made a kalka of it and applied on the wound. Because it is thicker, all the discharge is absorbed. The smell is also taken care of. Neem has got antibacterial and cleansing activity. So then the wound heals. Once you come to this stage, then you follow it up with application of taila or ghrita and then do the bandage. Okay, so this is how we have to follow it up. So when you write down the Samprapti Ghatakas, it will tell you, it will point out the correct pathway of what exactly you want to do. So first, write down the Ghatakas, then the principles of treatment. Please learn to write, or please practice, or please develop the habit of writing the principle of treatment that you want to adopt. Once you write down the principle, it will tell you which rasa you have to use, then the formulation, then come to the herbs or the formulations. Directly don't jump to the formulations. If you develop this, then automatically the thinking process will begin. See, this is one more, because I'm in Shalya, we got other cases. This is the case we had got, whose hand was stuck in a machine, and he was working in a milk factory, and he came to us. You can see the exposed tendons, and he has gone to orthopedic surgeons and everyone, but this was continuously non-healing, absolutely non-healing. He was advised the skin grafting. I think once he had advised, he underwent skin grafting, but it didn't take, and then it opened up. So he came to us and asked, can you help me? So you can see here, all parts are exposed. You can see the tendons which are exposed. You can see the muscle exposed. Then you can see slough also. Again, same principle. Even though there is no varicose vein, etc. Again, we treated on same principle as Vata Rakta. Because Rakta is affected, there is no movement of Raktena Avaritaha Patihi. That is the Samprapti of Vata Rakta. The Rakta movement, the flow of the Rakta is obstructed. So you have to treat it. Again, same principle, same simple medicines, 1 or 2 medicines. And this is what we are able to achieve. You can see it has closed completely with simple medicines and simple treatment. So you see, it's very simple. Then one more case is there, I will show. Yeah, this was a case. Tell me, what do you see? Which dosha, what comes to your mind when you see this?
It looks like Kusta.
Yeah. Dosha, tell me dosha. Dosha.
Try doshik actually.
So you see how extensive this is. Now, once the disease is so extensive, and he was a diabetic patient also, plus he has got extensive lesions. Of course, his diabetes was under control. Now here, when such a case comes to you, now in Ayurveda, we have got 2 forms of treatment. One is Shamana, one is Shodhana. Now when the disease is so extensive, will you think of Shamana or will you think of Shodhana?
Shodhana.
You have to think of Shodhana. Now this is what disease, this is in the skin. Okay, in the skin, Rasa and Rakta, Dhatu. And for this condition, which is the best treatment, which is best Shodhana?
Virechana.
Virechana. Right? So you plan Virechana. So again, this is a Pitta and Rakta condition, or even Vata, Tridoshaja, predominated by Pitta and Rakta. Which rasa you will select for Virechana? Which Snehapan? You have to use Snehapan, right? Internally, you have to do oleation.
Pikta.
So which Tikta rasa?
Panchatikta Krita.
Panchatikta Grata, Mahatikta Grata. Okay, so you start with that. And these are actually combined photos. You can see here on the right hand corner, lower end. This is actually after treatment. Before treatment is here, and then after. You can see the change with only the Snehapan. During Snehapan only, you can see the changes. And later on, the patient got benefited. So in these cases, do you think that with only one Virechana, the patient will get better?
No.
No, right? Because it is very clearly written in the text that these patients require repeated Virechana. So when you see these cases, when you write down the Samprapti Ghataka, before you actually start the treatment, you have to explain these things to the patient. Otherwise, they will come with a lot of hope. They will think that once the Srodana, purification, detox, we use these terms, detoxification, purification. They think that it's a miraculous cure. And with only 8 or 10 days of treatment, their disease can be controlled. It is not going to happen. So they require repeated Srodana. And that is what you have to tell them. You have to convince them. And you have to explain the importance of that. Then they have to come and get it done. Otherwise, what happens is the science goes into disrepute. They will think that Ayurveda doesn't work. If you are not clear, if you don't tell them the principles clearly, then they will start blaming Ayurveda for that, which in fact is wrong, isn't it? So this was one case, interesting cases. So these are the changes you can see. On the left-hand side, on the right-hand side, you can see the lesions are all cleared up. Okay. Still extensive, but they have all cleared up. You can see the change in the skin texture. This is only during the 5th day of Snehapan, after taking the Sneha during the 5th day. Later on, after Virechanas, and then he underwent two Virechanas. This was one more case that we treated. This was a patient who had, deformed leg. She was not able to walk, so she had to put pressure on the outer side of the leg like this. And you see, she was a diabetic patient, and the wound had opened up. So she could not go to the hospital also every day because she was not able to walk. So we were called, we went to the house and we advised her what treatment has to be taken. We started the treatment again, very simple, same treatment, external treatments, and internally only one medicine was given. Externally, one kashaya for wash and application, and then bandaging. And this is the result. You can see the wound has healed completely. After that, she was able to walk properly. Okay. So this was within 15 days of treatment.
Dr. Aakash, obviously a part of that pathology is due to mechanics.
Yeah.
So what did you do to alleviate the symptom of pressing on the outside of her foot?
Yeah, so we work with a surgeon who is a diabetic foot surgeon also, who has developed a specialized footwear depending on their requirement. So it was advised to her, and she was asked to wear those footwear for that.
Does it also make any difference which type of prameha they've got in terms of your treatment?
No, it doesn't make any difference, because this was a clear-cut case of what you call last 20th variety, which you call as Madhumeha. It was not any other kind of mehas which were there. This was a case of Madhumeha, clear-cut. But yes, depending on the kind of meha, see, diagnosing different kinds of meha is very difficult, because we need to have a proper understanding. We need to do Mutra Pariksha, and other symptomatologists have to be taken into consideration. Unfortunately, we think that all mehas are pramehas only. And the patient, even if they come to us in initial stages, we may not be in a position to diagnose them as a particular kind of meha, because clinically we are not so expert, or probably we don't have the patience to go through all the details. And that's why we need to work out on all these parameters, and then we can start treating it. Because depending on the kind of meha, acharyas have advised one specific herb for each kind of prameha. So if you follow that routine, then I think that we'll be able to achieve success in that. Okay, so this completes my presentation. Of course, we've got a lot of photos and images and other things, but I hope that I've been able to give you a summary of what you need to do when you see a patient, and how important developing the Samprapti Ghataka is in each and every patient. Once you start working on the components, then it will guide you to the direction of the treatment, the principles, and it will also tell you the prognosis and what all you have to do. If you've got any further questions, I'll be more than happy to take your questions. How much time do we have got left, Colette?
We have 1 hour left, Dr. Aakash.
1 hour?
Mm-hmm.
Sure.
With a 5-minute break in between. Okay. We've got a few questions.
Yeah. I will continue later. Mm-hmm. It's up to 9 p.m., right? 9 p.m. India time. Okay.
9 p.m.
Yeah. So a question from myself, actually. So with the Vata Rakta examples, when you were applying Neem Kalka to heal it, is it then later washed off? And I was just wondering practically if any bits of the kalka, the churna kind of sticks to the wound, and if that's a problem, or is the kalka so fine that it's not really an issue and it washes off easily?
Yeah, it washes off easily. So we apply it and leave it till the next day when the patient comes. Then you do the parisheka. By doing the parisheka, it will wash off.
Okay.
Yeah. This kalka is prepared by the neem leaves, not with neem powder. So we get the fresh leaves and then we make a bolus of it and then we can apply it.
Okay, that makes sense.
There is another question from Christina. Christina, do correct me if I'm wrong. Is it related to the same what Colette has asked? Would the same concept work with maternal ulcer in badly managed high BP and very poor condition of blood vessels in elderly patients? Or other would supportive treatment would be used along?
Yeah, I mean, generally all the ulcers and these conditions are treated on the same lines of Vata Rakta. But when you say that very clearly that badly managed high BP and very poor condition of blood vessels, you have to give Rakta Prasadaka Dravyas. Of course, the choice of medicines, you can add some other medicines, but this has to be monitored. If it can be monitored on a regular basis as to what medicines have to be given. Because sometimes when we are dealing with ulcers and wounds, there is always the possibility that it may end up getting more complicated than we think otherwise to be. So it's always better to follow it up with monitoring, proper monitoring. But yes, the principles would remain the same. Same Rakta Prasadaka Dravyas. Our medicines, you see, the benefit of giving our medicines is that it will not, like you have mentioned here that there will be poor condition of the blood vessels. So Sira Shaithilya is written as in the Raktakshaya Lakshanas is there. Sira Shaitilata is there. So to improve the functioning, that is why we have to understand that the Sira, if you remember in the first session, I told you Srotas is formed with Mams also. So you have to strengthen. So the basic formation of the dosha, dhatu and other structures should not be forgotten. And our medicines should contain ingredients which will strengthen the blood circulation also. So yes, the same principles can be applied. For this, we follow, in our clinical practice, we follow the 16 measures of treatment which have been given by Shrota, which are called as Shashti Upakrama. So he has given 60 methods of treatment of an ulcer. We can pick and choose, we can combine it, we can do permutation and combination depending on the condition of the patient, and they always have given results. But ultimately, it comes down to your assessment of the dosha, dhatu, mala, srotas, and the lakshanas for you to pick the medicines and what medicines you are going. For example, in the other condition I told you, slough was there. Now, if there is a diabetic foot patient with a lot of slough, okay, a lot of unwanted tissue is there, and the patient doesn't want to undergo surgery, how will you wash the wound? Can you tell me? By just washing the wound, the slough has to be removed. What will you use?
Would Kashaya Rasa help? So Kashaya Tikta to absorb it a bit.
How will you prepare the Kashaya decoction? In what media you will use? Generally, we prepare Kashaya with water, right? We boil the herbs in water and that will make it Kashaya. But if there is excess kapha lakshanas, that is all slough discharges, all sticky discharges are all kapha lakshanas, ama lakshanas, and they are so adamant, that they are so sticky that they will not be removed by simple water.
Gomutra.
Gomutra, yes. So we have to prepare the decoction by boiling the herbs in cow urine. And then it will make it very potent. And if you use it, immediately it will work like a surgical debridement only. So you see, there are ways and means. So you have to understand the underlying samprapti so that you can understand to which form and how you have to select and how you have to prepare the medicine. Okay. Or you use medicines or herbs. Suppose Gomutra is not available, cow urine is not available. Okay. Then you select herbs which are a little bit tikshna, but you monitor the condition. Okay. You monitor the outcome.
I'm at risk here of sounding like somebody who's stopping Ayurveda, but I know from my own experience, you would not be able to use cow's urine or even treat an ulcer that size on a patient. You can do it in India, and I've seen it work, but I doubt if we did it here, we'd be in quite serious trouble.
Yes, yes. No, I understand. You know, every you have to know the limitations of your practice and the rules and regulations that come with it. But yes, if there is somebody who is willing to work, and if there is a collaborative kind of a work, if they're interested, then you can try. There is no harm in trying. The same thing applies here also. One, I can share an example of initially when I started coming to London. At that time, it was in Thames Valley University. One of the students' father had cancer. He was diagnosed with lung cancer, and so the student asked, "Can I do a consultation and advise some medicines to him?" So, on taking history and everything, so we found out, and obviously I was in London, and he was under the care of his onco surgeon. Yeah, Kate, I'll get back to you in a minute. There is a reference of that. So this this gentleman was already in the treatment of an oncosurgeon. Now, that the oncosurgeon who was treating him was of Indian origin, so he knew about Ayurveda and the supportive care that was given. So he came to me and he said, "Look, this is what I can do," and that is so. Here, I planned only Rasayana treatment, no other treatment, because I was already taking chemotherapy and other medicines from allopathic treatment. And he said, "How will it help me?" I said, "Look, we work on improving your immunity so that whatever the outcome is there, I didn't tell him that I'm going to cure your cancer. It's just that he was given a particular time frame to survive. The prognosis was very poor. So he said he was there to find out if Ayurveda can make him live a little bit longer than what was there. So that was a challenge. So I started with simple herbs and medicines. So what I gave him was very simple. You get fresh amalaki, so 2 teaspoons of amalaki juice with a pinch of turmeric, okay, and guduchi in that, and guduchi sattva was available. We get guduchi sattva, which is the extract of guduchi. So this I asked him to mix it and take it every day, 2 to 3 times a day, and diet advice I gave him. So he started it religiously. His main question was how to get the swarasa out of amalaki, because the fresh amalaki is very big and hard, so you cannot easily get the juice out of it. So I told him, cut the amalaki into pieces and then soak it in a little bit warm or hot water. It will become soft, and then you can squeeze it or press it and you can do it. Now his main question was, now amalaki or Indian gooseberry, he was of the opinion, that is what is promoted as, that it contains a lot of vitamin C, and vitamin C is not heat stable. So his question was, if I boil amalaki or if I put it in hot water, all the vitamin C will be lost. So how will I get the benefit of vitamin C? Then I had to tell him, look, I don't know whether amalaki contains vitamin C or not. Charaka doesn't talk of vitamin C. Charaka talked of amalaki as a rasayana. So I want to use it just like the way I'm using it. I'm telling you to use it. So he started using it. Luckily, I don't know whether Ayurveda worked or his faith in Ayurveda worked or the herbs were potent, whatever. But this person was given a lifespan of 6 months, but he went on to survive for 2.5 years, and he became a very strong proponent of Ayurveda. And I made, because he had got colon cancer and lung cancer, so I made him to drink takra. Initially, I was very reluctant, but then he became such a great fan of this buttermilk that he started promoting to every one of his friends and family and all. So what I'm trying to say is, you can work your way around it if there are some people who are willing to accept it, because it takes, yes, regulations are there and everything, but if you can work your way around it, develop collaborative practices, because now the entire world is opening up to Ayurveda. But yes, it is quite a challenge, especially treating such bigger cases, and no issues about, no doubt about it. Yeah, Kate, there is a mention of using maggots in Ayurveda. Astanga, there is a reference where he says that you have to keep in chronic non-healing ulcers, you have to keep flesh, meat. When you keep meat, then he says that insects will come and devour that. That is a maggot, and that will eat away the unwanted flesh, or the dushita mamsa, he says, and then it can be treated. So yes, there is a reference.
You could probably use also leeches too.
Yeah, leeches are also used, definitely. That high BP caused ulcer would, in that case of turmeric plus amulek, addition of ashwagandha would work to support the blood vessels. Yes, definitely. You can add guruchi to it. Yashtimatu is also good. Shatavar is also good. You can give these medicines. So guruchi, turmeric, and amulek, the best rasayanas you can have for the rasavasrotas, or sorry, raktavasrotas. No doubt about it. So do we take a break now, or?
Yes, Dr. Aakash, we can take a 5-minute break.
Okay.
I think one of the attendees, Susan, was asking if we could maybe do another case study or so after that.
Yes. I will. We can go through a case study.
Wonderful. Some property.
Yes.
Right.
Yes. Okay.
So 5 minutes from now, so that will be 2:50, 2:49. Let's say 2:50.
I'm very sorry, because I'm the head of the college. There are some administrative issues which just came and I had to attend to a call. Please excuse me for that. And yeah.
No problem, Dr. Aakash. There was a few more questions, but perhaps we should do some property first.
Yeah.
And then we do the last few questions.
Yeah. I'll just share the screen. I've just typed in symptoms so that we can work out the symptoms. Can you see my screen?
It's perfect.
So this is one patient that we had. I'm just typing up the symptoms as we speak now. So he's a 45-year-old male. He's a known case of diabetes, but with uncontrolled blood sugar levels. And he presented with burning urination, increased frequency of urination, and itching all over the body. Okay. Now, his past history. He had he said that he had viral fever for which he took antibiotics for 3 weeks, for which he has prescribed antibiotics for 3 weeks. Okay. So this is what the history is. And this is the patient who came to us. So now what we need to do is work out the samprapti and the samprapti ghataka of this patient. Okay. So to begin with, I'll just type here. Can you tell me which dosha is it? Which dosha are you thinking now?
Kapha with the itching.
Okay, kapha.
And with Madhumeha, isn't it always all 3 doshas though? Isn't Vata also definitely involved?
Again, can you be specific? Can you do the amshamsha kalapana? Can you do the subtypes?
Yeah.
Are you able to work out the subtypes?
Apana Vayu.
Okay, let me type in as well. Okay, Apana Vayu. Then?
Brajaka Pitta.
Brajaka, okay. Then?
Pledaka Kapha.
Pledaka Kapha, okay. So we'll start with these 3. Now, what has happened to Apana Vayu? Which guna of Vayu is affected?
Kala?
What has happened to Apana Vayu? So, okay, let me come back to that. Which srotas? Can you tell me which srotas will work?
Mutravaha, Mutravaha Srotas.
Mutravaha, okay. Then
Anavaha.
what is Annava? Why Annavaha?
With the itching, you'd have rasa and rakta.
Okay, rasa and rakta. Okay, what has happened to Mutra Srotas? What is the srotodushti?
I don't know. Avipratika? No, how do you call it? Is the excess flow or the
Excess, ati pravritti.
Yeah.
Okay. Ati pravritti is there. So, what has happened to Apan Vayu? Is it increased in its actions or decreased in its actions?
There's too much movement down, too much chala.
So is it the guna which is increased or the karma which has increased?
The karma.
Karma vruddhi, right?
But surely if chala guna increases, isn't that also producing that?
Yeah. So chala guna leads to karma vruddhi, right? Okay. So he has got uncontrolled blood sugar. So if you want to treat this patient, what all will you think of? Can you tell me the treatment principle? What you want to achieve here?
You have to first improve the overall agni so that the sugar is controlled.
Treatment principle. Okay. What do you want to do?
Deepana.
Now, why does this patient have burning sensation, burning urination? Increased frequency you can understand, but why does he have burning urination? What can be the cause of that?
It could be cystitis. I don't know how you say that in Sanskrit.
Yeah, that's okay. No problem.
Virus, the fever, the viral fever that he was taking the antibiotics for.
Yeah.
Increased pitta, mixing the up of pitta.
Pitta. Okay.
The water component of pitta.
There is a burning urination. There is increased frequency of urination. So treatment principle is what? What are you addressing here? Are you addressing the sugar, or how will you address this?
Trying to reduce the kledaka.
Reduce the kledaka. Okay. Fine.
To some degree, pitta shamana, but without cooling too much.
Okay, pitta shamana. Fine. So which rasa will you use here?
Kashaya. Kashaya.
Tikta rasa.
Kashaya and tikta rasa. Okay. Kashaya is stambana. Tikta rasa is also grahi. Because the very definition of prameha is when there is increased frequency of urination. So you have to reduce the number of times. So there you have to do grahana or the stambana. Obviously you cannot completely stop urination. So you have to do grahana, grahi karma, that is, you have to reduce the outflow of that. So here tikta rasa and kashaya rasa medicines are given. Which formulations are contraindicated? Which type of formulations are contraindicated here?
Asavanarishta.
Asavarishta you cannot give. Right? All grita and leha preparations you cannot give. Any churna with sugars you cannot give. So that leaves us with guti, vati and kashayams. Isn't it? So that leaves us with those three options that you have to give.
And churna without the sugar.
Churna without the sugar. Some churnas without the sugar. So can you name some formulations that you can give in this patient that you can use there in your clinic in UK or wherever you're from?
Well, really, we can't really use many formulations. We're not really allowed.
So what will you use then?
Individual herbs.
Which will you select?
Bhumiyamalaki.
Guduchi.
Okay.
Karela.
Bokshura.
Amalaki.
Okay. Anything
What
else?
about for Kashaya Rasa, some Arjuna or Ashoka?
Arjuna, Ashoka. Okay.
Nimba.
Now we are talking about Mutra Srotas, right? So Srotas wise, Mutra is related to which dosha? Kapha dosha. Punarnava. Punarnava will increase the urination or decrease the urination?
Increase.
Increase the urination, right? And Punarnava, you have to also think of whether it is Shita Virya or Ushna Virya, but because there is, so you have to select a medicine which is Shita Virya also, because there is a burning sensation, but at the same time it is Tikta Rasa and a Shita Virya Dravya. So Guruchi is one you can use. Amalaki is also Shita Virya you can use. Anything else?
I thought Guduchi was Ushna Virya. Is it
But
not?
there it has got Madhura, it has got Madhura Tikta Kashaya. See, that is some of the herbs, again, that is a separate topic for discussion. You know, some of the herbs follow the rules of what you call as Samana Pratyarabdha, and some of them are Vichitra Pratyarabdha. So some medicines, some herbs work by, depending on the Srotas that you select. So that is why selection of the Srotas wise herbs is also important criteria for us to decide the medications. If you are restricted by the number of medicines that you can use, of course you have to mix and match them and you can use it. But yes,
Christina has a good suggestion, which is Nisha Amalaki.
Nisha Amalaki, yeah. So Nisha is Haridra and Amalaki. Nisha Amalaki is good in these conditions. So formulation. Gudumar you can use, that is to control the blood sugar levels.
Neem.
Yeah, neem will work. Neem will work, Manjishta will work, Lodhra, Ashoka, all these are Kashaya Rasa and work on the urinary tract. That will help.
Dr. Aakash, Christina also said coriander, like dhanyaka, coriander seeds.
Yeah, coriander seeds you can use. Dhanyaka we can use in the form of what you call as hot infusion. Sorry, cold hot infusion. Or dhanyaka hima, cold infusion. That will give a better diuretic effect. Also, you see corn, sweet corn. That is also a very good medicine for the urinary tract diseases, because the whole plant of corn is a diuretic. The whole, including the cob and the silk, the corn silk that you get, that if you boil and give the water, that will give good results. Okay. But shall I type in another case?
Please.
You want to work on another case? Okay. So this is a very interesting case we had. Okay. This is a 48-year-old male. Came with low backache, radiating pain in the right leg, and numbness and stiffness in the calf region. Plus, he also had pain in both the shoulder girdles, that is both sides of the shoulders, and radiating pain in the right arm up to the fingertips. Then he had restricted mobility. He was not able to move properly, unable to squat or sit down for a longer period of time. Okay, so this was a patient who came low backache, radiating pain in the right leg, numbness and stiffness in the calf region. So stiffness, pain in both the shoulder girdles and radiating pain in right arm up to the fingertips, restricted mobility, unable to squat. Okay. So write down, tell me the dosha.
Is there any history, anything that happened before this that you can remember?
No history, no particular history. It just started, this low backache, he says it started about 1 year back. No injury, no fall, no illness. He is basically a person who works in a farm, agriculture. He has been working manual labor. He is working very hard. Manual labor work. Okay, dosha.
So this might be like ruksha or lagu of vata, like vatakshaya type situation.
Okay, vata, which vata?
Vata Vyadi.
Which vata?
Apana.
Vyana.
Apana, then?
Vyana.
Vyana. Okay, which guna of vata?
Ruksha, lagu.
Let me write the guna. What are the guna of vata? Ruksha.
Ruksha khara. Patra ruksha, lagu khara sukshma.
Shita, then khara.
Khara sukshma. Chala.
Sukshma and chala. Okay, which of these are affected?
Ruksha khara. Lagu.
Rukshata is increased or decreased?
Increased.
Increased, okay. Then
How do we know that?
How
do we know that ruksha is increased here?
Yeah. Can the person who said ruksha answer?
Sure. I am assuming that the radiating pain is coming from overwork and from some dhatuk shai in the lower back. Right. So just from the history of knowing, like an Indian man who is undergoing manual labor, back pain is very often going to be from overwork and overuse, rather than sort of stiff and sedative kind of sitting and accumulation. So I'm going more this is like Vatak Shai routes, and assuming that the...
No, is it Vatak Shaya or Vata Vriddhi?
Vriddhi. Yeah.
Ruksha is increased, right?
Yeah, it would cause stiffness.
Sorry, Dhatuk Shai caused by Vriddhi.
Yeah.
Stiffness in muscles.
Yeah.
Dryness. Yeah, precisely.
Dryness, you see, Rukshata need not necessarily be seen only in the skin. Generally, we tend to associate Rukshata only in the skin and external manifestation, but Rukshata can occur in any of the tissues of the body. Internally also it can occur. So nerve sheath, nerve fiber, nerve conduction, all of these can be stopped and affected when there is increased Rukshata, when there is increased exposure to sun. Proper food is also not there. These people take a lot of Ruksha foods kind of thing. So in that sense, you can say. So Ruksha is increased. Any other guna which is affected?
Sukshma.
What has happened to Sukshma?
Because of the numbness.
So what has happened? Increased or decreased?
Decreased.
Decreased, yeah. It has to decrease. Therefore, there is no sensation. Numbness is there. It is not able to penetrate. So therefore, it is not able to perform the action correctly. Right? So all Vata Vriddhi Lakshanas are there. Rasakshaya Lakshanas are there. And Kafakshaya can also be understood by this. So Rasakshaya, Vata Vriddhi Lakshana. Now, which dhatu of Vata is related to?
Asti.
Asti. Okay. So low backache and radiating pain in the hand. Which bones are you thinking?
So it's the vertebrae, and it's also the bones on the shoulders.
Vertebral column. So we have to think of the cervical vertebra and the lumbar vertebra, right?
Lumbar, yeah.
So all the nerves come from the cervical region only. Even those going to the lower limb, they come from the cervical vertebra only. So the vertebral column, so cervical vertebra and the lumbar vertebra. So here, what has happened now? There is a relation between Asti and Vata. Okay. So what has Vata done now?
destroyed some of the tissue quality. You get that Shaya.
By what? By entering into the Asti, right? It is entering. So this is what we call as Gata Vata, Asti Gata Vata. Gata Vata concept. It goes and lodges there. Vata has gone and lodged. Of course, it resides in Asti, but Vata has increased to such an extent that it is again increased in its quantity as well as quality, and it has gone there and lodged, and it is causing the destruction of the bone. So if you take an X-ray of this patient, it will show either osteoporosis or cervical vertebral lesions, disc problems. Any of these things could have happened. So now, what is the line of treatment you want to do here?
Brahmana.
Madhu Virechana and followed by Tikta Yapna milk pasties.
Which is the best treatment? Which is the best treatment for Vata?
Basti.
Basti. So Basti is a treatment that you have to give. Now, specifically in relation to Vata and Asti, the rule is you have to select Tikta, Rasa, Ghrita, and Kshira Basti. Tikta Rasa, Ghrita, and Kshira Basti you have to give. Why Tikta Rasa?
Carry it to the bone, for the Asti.
Sorry?
For the Asti, to carry it to...
It has to go, it has to carry it to that, right? Now, can you tell me the Panchabhautika composition of Tikta Rasa?
Akasha and Vayu.
Akasha and Vayu. Okay. Now, when Acharyas talk of what is the main function of Akasha and Vayu, Vayu does the Vibhajana and Akasha does Vivardhana. It increases the space. Okay. Now, when you are, for example, when you are treating Ama, which rasa you give?
Atu.
Tikta. Tikta rasa is given in Ama. Why? Because it contains Vayu and Akasha. So Tikta rasa, because it contains Vayu, Vayu is a good, what you call, Vayu is a rasa which, Vayu is a guna or Vayu is a Mahabhuta, which will blow the Agni or kindle the Agni, because without Vata, Agni cannot survive. So Ama is sticky in nature. So when you give Tikta rasa, that stickiness and that mass which is formed there, it will be broken up by the Vayu, and because of the Akasha Mahabhuta, the Vayu will be able to enter into the spaces, minute spaces there, and it will be able to blow the and kindle the Agni. So Tikta rasa dravyas are also Deepana. They are also Pachan. Whereas Pachan, the Katu rasa is only Pachan. It will not do the Agni Deepana. So there are many things that so here when you give Tikta rasa sadhita Kshira Basti, so there you have to control Vata. Brahmana also has to be done. Here you cannot do. For example, Basti, what kind of Basti is this? This is called as Brahmana Basti. Nourishing Basti, right? You have to give Brahmana Basti. You cannot do Shodhana. Can you do Niruhana Basti here?
No.
Cleansing Basti cannot be done. It will aggravate Vata further, isn't it? So when you are preparing the decoction, you have to prepare the Kshira Paka. You have to prepare with milk. And in some instances, as was somebody was mentioning, Yapana Basti, Raja Yapana Basti, where we use meat. Meat is used, and it is cooked. Decoction is prepared from the meat, and then it is given. So it is more strengthening and it is more nourishing. So in all Vata Vyadhi, you can use meat to strengthen, if especially related to muscle. Muscular dystrophies. In those conditions, you can give. And Basti in these cases will give fantastic results. Brilliant results can be given. No need to undergo any surgery unless the patient is bedridden, he cannot move. If the patient is able to move around, even if there is stiffness, numbness, severe pain also, you give one course of Basti, the patient will improve. And then again you convince him to take second course of Basti after 3 months. Wonderful results. We have treated many cases, and we have even prevented people who are going for surgery also. You can prevent it, surgery. There is no need to do surgery also. It gives fantastic results. Now suppose this patient has come to you and he says, okay, I can understand the need for Basti, but I'm not in a position to take Basti now. I'll come back later. Can you give me some medicines? What will you give?
Gugulu formulas.
Which one?
Like Yogaraj.
Why Yogaraj?
Maybe. Well, for the vata to come down. For the vata to reduce. And
okay. Any other Gugulus you can?
Sindava.
Use the same concept here.
Bitter ghees could be used as well, and followed by Nasya, Kshiram Bala, maybe Nasya for the upper region.
So, same Tikta Rasa Ghrita. For example, Gugul Tikta Ghrita. Okay?
Yeah.
You can give when it is to be given and how it is to be given. What will be the Anupana?
Warm water again.
Better than that?
Milk.
Milk. Milk will be a better option. Okay. So Tikta Rasa. When it is to be given, at what time?
Again, before food, because Apanavayu.
This is the guide. Apanavayu. Low backache is there, right? Apanavayu. So Apanavayu Kshetra, then you give Gugul Tikta Ghrita before food 3 times a day, 2 times a day, depending on how often the patient can take. Okay. Then along with that,
ask if the client said, look, I can't do this course of Kshira Basti, but I could do an Anuvasana Basti at home. Would you, I mean, you know, something like Mahanarayan Taila or something, would you feel that was going to have some results at least?
No, instead of Mahanarayan Taila, use Ghrita Basti only.
Ghrita Basti.
Yeah, give Anuvasana Basti. Or instead of Mahanarayana, you have to give Brahmana Taila, like Ashwagandha Taila, Dashmula Taila. Mix and match them. Mix and match the Tailas, for which whatever results you require, and then you can even mix Ghrita and Taila, like Sahacharadi. Sahacharadi Taila is for lower limb, Bastis. So Sahacharadi Taila or Kshirabala Taila, which is Brahmana. So Kshirabala, mix it with Gugul Tikta Ghrita. So both you can mix. So this is called as Yamaka Sneha. When you have to mix 2 kinds of Snehas, you can give that. So that you can give as Anuvasana Basti. That is also possible. Even Anuvasana Basti is also okay, no problem. The longer the patient retains it, the better it is. No issues. Okay, if you want to give Nasya, somebody was mentioning Nasya. In what form you will give Nasya? Which kind of Nasya it is called as?
Brahmana.
Brahmana. But will you do the proper Nasya course, or you'll ask the patient to put drops?
Pratimarshana.
Pratimarshana Nasya. So Pratimarshana Nasya, how many times you can give? 2 times, 3 times, 4 times. What will you use?
Dhanvantara 101.
Which one? Sorry, I didn't get you.
You could give Kshirabala or Dhanvantara 101, 101.
Yeah. So when you're giving Basti, especially in cervical spondylosis or other conditions, so initially remember, because there is stiffness and numbness, stiffness is there, right? So it may indicate that there is some obstruction and kapha may be there. So if you assess that there are some ama lakshanas and kapha lakshanas, initially for the first week or 5 days, give Anutaila or Shadabindu Taila, because to remove the Srotas, to do some kind of Shodhana, Shiro Virachana, and then follow it up with Kshirabala Taila. That is for you to assess, okay, if it is required or not. If it is only pure Vata, only pain and stiffness, numbness due to pure Vata, if you assess, then straight away start with Brahmana Nasya. Otherwise, initially you do some Anutaila, and then after 4 or 5 days, you can shift the patient onto the Kshirabala Taila or other Tailas which are available. Okay. Sorry, what's the time, Palit? Are we on time or do we still have time?
We've got about 6 minutes left.
Okay.
There are a few questions in the chat box as well.
Sure.
So if you'd like me to read them, maybe. Or...
Yeah. You can do.
So Kate was asking if you had any views on autoimmune diseases, or do you just use the same Samprapti Kataka and look strictly from an Ayurvedic viewpoint, not making any assumptions about the autoimmune nature of the disease?
Yeah. Autoimmune diseases, yes, we have to work the same. See, whatever the case is presented to us, we try to work it out from our principles first. Second component will come as to our understanding of what the disease is from a modern perspective, because that will tell us to understand the limitations that Ayurveda has or modern science has. It's not that every case can be treated in Ayurveda, or not every disease can be understood completely to its entirety. We can form what is called as a working samprapti, or a samprapti to just begin our thought process. So autoimmune diseases, yes, from an Ayurvedic perspective, we work out. Depending on what particular diseases you are encountering, you understand from modern perspective and see how best you can do. Because you see, if it is an autoimmune disease, it just means that the body, your own body cells are attacking you. Now, from an Ayurvedic perspective, when you say we are trying to improve the immune system, the question comes as to, are we trying to actually improve the body attacking itself or no? Or are we trying to prevent that attack? So this kind of a question or this kind of a questioning can come into the mind. But from an Ayurvedic perspective, when you treat these diseases, we are actually strengthening the body defenses so that this effect is reduced. And that is why the concept of rasayana is there. So yes, autoimmune disease can be analyzed. First, analyze it from Ayurvedic perspective. Leave apart whatever the modern science is telling you, whatever the diagnosis is. Just keep it aside. Listen to the symptoms, how it has developed, and the process of development as we discussed in the samprapti. Write down the samprapti ghatakas. Then catch hold of that disease, name of the disease. If you know it, well and good. If you don't know it, read about it and see how best you can integrate it and what needs to be approached and what needs to be targeted. That is there. But because it's an autoimmune disease, the prognosis, roga marga sadhya sadhyata, will be a little bit difficult. Either it will be krachar sadhya or yapya, or it may fall into asadhya values. Because as of now, the question is because there are not many cases which come to us so that we can conclusively say, or we can give evidence that, look, we have treated so many cases, so this is going to be the result. That's why I use the word working samprapti or working, samprapti ghatakas. So for this has to be different for each patient. So we try to work around that and see how best we can help it, because it is going to take time to help these patients. But we have had our seniors and friends who have been treating, for example, Srotas says in many of these autoimmune diseases, and if you work out that it is a vata condition or predominant vata condition, basti, and he says you have to give 18 courses of basti. So imagine, you are giving 18 courses of basti. The patient should also have, and we have one of our two seniors or friends who are trying this and they have got results. But that takes so much of time and effort from both the patient as well as the doctor. So yes, we can analyze, no doubt about it, from Ayurvedic perspective.
Wonderful, amazing, Dr. Aakash. I think that is the end of the questions. And we've only got about 2-3 minutes left. We've got just one question coming in now from Christina. If there's any tips for stopping a violent vata pitta vomiting. I think violent vomiting or strong vomiting for vata pitta.
Yeah, treating vomiting will be a bit challenging because one, it will not allow us to give anything orally. So that is a major drawback that, or challenge or limitation that we can say when it comes to vomiting. When you say violent, I don't know, what cause you're referring to, or is it just biliousness or acidity related to that? Intermittent, what we can do is between the two bouts of vomiting, or if there is continuous vomiting, we get a medicine called as Kamaduga rasa. You can powder that and add a little bit of, we have to use what you call some mineral preparations. In India, we use pravala bhasma, which is coral. We get pravala, coral powder or bhasma, that we can mix with Kamaduga rasa. Or simple, there is a medicine which is called as Gairika churna, which is again a mineral preparation. So these things are given internally, but again, not very effective because the patient will not like to take anything orally. So yes, in vomiting, there is a little bit of what you call limitation in terms of what medicines we can advise. If it is something which is, when you use the word violent, I'm understanding that.
If I may kind of jump into it, as it was a kind of my question of a patient who had a violent reaction to a quarter of a teaspoon of erandapaka taken at night. And it is a kind of a patient that suffers with vatika types of problems and constipations and lower back. And it was a minute dose. And soon after, I suspected that there was some hidden pitta that was not detected during consultation, but still the vomiting was too violent. It went into ativamana.
Yeah. If that is the case, then yes, it has to be treated according to lines of emergency or whatever it is.
So what would be kind of, in that emergency moment when everything comes out and nothing stays in, what can be done? I mean, the cooling, sprinkling of water and, things like that would be kind of just were not sufficient.
Yeah, it will not be sufficient. There are some applications which can apply, which you can apply on the navel and the epigastric region, cooling herbs like Sariva, Ushira, Chandana, if you have these. And some the medicines to be applied on the, the thalam, that is on the head, protect the marma and etc. These are some things that you can try. But if the patient is going into severe vomiting and dehydration, then I think it is better to treat it, as per the emergency condition. But medicine-wise, because like I said, it is there is an indication that you can sometimes give basti and try to pull it down. But in that state, I am not sure if the patient will be willing to undergo that. So it may not be possible to do that. So there are some, like I said, extreme vomiting or violent vomiting can be a cause. And as Ayurveda says, sometimes it's better to allow for the doshas to go out. No, this is the body reacting, and then it is better to, as long as the patient's bala is good and they're able to sustain it, it's okay.
But if they are not able to sustain it, then it's coming into this ativamana when you're seeing a washed meat kind of vomiting. How do you stop that at that stage? Because that's a stage where it's kind of beyond.
Yeah. There is a medicine which we call as Mayur Picha Basma, which is the ash of the, peacock feathers. You get this medicine ready prepared. This is available in the market. So you just take that and make the patient lick it. But like I told you, if the patient is unable to lick and if there is a continuous vomiting, then there's nothing you can do to stop it actually. There is also a mention of Laja Manda. Laja is what you call popcorn.
Yes.
If you can make a fine powder of that is very light and fluffy, it will stop the vomiting. But they should be able to eat it. That's the whole issue.
Okay, thank you.
Wonderful. Thank you very much, Dr. Aakash, for a really enlightening workshop. I think everyone got a lot from it. I think I certainly did, and I think it really helps us to dive deeper into the basic principles of Ayurveda. I think it's very easy for us to get caught up in treating symptoms and forgetting about the samprapti. So thank you really, really much. Yeah, thank you very much for all your time. I think also your beautiful dogs in the background announced that it was time to stop.
It was their dinner time, so
yeah. So thank you so much for doing this on a Saturday night.
Thank you all.
Yeah, we look forward to seeing you. And yeah, all the feedback is amazing from everyone. So thank you.
Thank you so much.
Angela, I hope Murray says thanks very much, and to the dog.
Thank you all. Thank you.
And send our best wishes to Dr. Anita and to Ayuda as well. Will do.
Thank you everyone for joining us, and I hope all of you enjoyed it, and look forward to see you again. Thank you, and namaste. Namaste to everyone.
Thank you.
Thank you. Namaste.
Namaste.